Good morning, ladies and gentlemen and distinguished dignitaries. Welcome to third edition of Chintan Shivir, which is an initiative of Ministry of Commerce and Industry. I invite Sri Chakravarti AVPS, our Chair Corporate Communications, to welcome the guests.
Very good morning to all of you. Such a landmark and a significant day today. A warm welcome to all the distinguished dignitaries, respected leaders from the government and industry, esteemed colleagues and dear friends. A sincere welcome to all of you on behalf of one of the most exciting, one of the most active, one of the most contributing, the Export Council, that's our own Pharmaceutical Export Promotion Council of India, Pharmexcil. A round of applause for our own council. Thank you very much. It's my privilege and honor to welcome you all to this important gathering as we come together to deliberate on a subject that's not just relevant, but absolutely critical to India's global standing. Scaling up pharma exports, that's the theme. At the outset, I extend a very warm welcome to our chief guest of the day. Our sincere thanks to him. We all know the dynamic Commerce Secretary, Sri Rajesh Agrawal ISG, Department of Commerce, and we are very fortunate after taking oath the first time he's making a maiden visit only to embrace the Pharmexcil, and we are so happy and thanks from our bottom of hearts, sir. Thank you very much. Sir, your presence here today reflects the government of India's strong commitment to strengthening our pharmaceutical sector and enabling it to complete and compete globally with confidence and resilience. Thank you very much, sir, once again. You will be a big source of inspiration for all of us today. I also welcome Sri Mohit Yadav ji, Sri Satyaprakash ji. Sri Satyaprakash ji is the Joint Secretary, DOP, and Sri Mohit Yadav ji is Joint Secretary, Department of Commerce and Industry. In fact, he's our boss at Pharmaceuticals. And our dynamic chairman, Mr. Namit Joshi, Mr. Nipun Jain, our colleague, and he is also IFEX chairman. And last but not least, Mr. Rajabanu, the active Director General of Pharmexcil. A warmly welcome all of you. I request my chairman, Namit Joshi and Rajabanu, to escort and bring the guests onto the dais. Sir, your leadership and guidance continue to shape the direction of this industry at a very crucial juncture. A heartfelt welcome as well to all the CEOs, industry leaders, policy makers, and stakeholders who have joined today forward for their lighting of the lamp auspicious day. Thank you. proudly acknowledge the honorable presence of the bigwigs of Hyderabad Pharma, Sri Chava Sachayana Garu, the chairman of Laurus Laboratories, Sri Ramesh Babu Garu, SMS Pharma, Dr. Ramesh Rao Garu, the BDMA president, Dr. Appaji Garu, the founder Director General of Pharmexcil, Jayant Tagore, the former BDMA president, and so many other CEOs, Mr. Agarwal, and I can't name each and everyone. Thank you so much. Many people are joining also. Rajiv is joining, and Granules Gland and many other companies CEOs are joining a movement for the roundtable as well. And I request our chairman and Director General, both of them, to felicitate the chief guest as a mark of honor. Today it's our responsibility to welcome him with a big heart. Now to Satyaprakash ji. Sri Mohit Yadav ji. Request all the dignitaries to stand for a group photo.
One more. Just a second, sir. Just the same for electronic media. No. Yeah.
Thank you, sir. Now I request my chairman, Mr. Nami Joshi, for his welcome remarks. Over to you, sir.
Thank you, Chakravarti Garu. I think most part of the welcoming note has been already addressed by you, so I have a limited scope left, but still I'll try to do justice with that welcome note. Good morning, everyone. Good morning, dignitaries. Good morning, dear guests, industry leaders, everyone who could spare his valuable time to attend this third Chintan Shivir organized under the aegis of Ministry of Commerce, Department of Pharmaceutical, as well as Pharmexcil. Now, it's an important day for us. The reason being that I have, in 4 years stint with Pharmexcil, I've never seen Commerce Secretary, GS Commerce, and GS DOB on the platform of Pharmexcil coming together. That also puts in a lot of value towards our objective of conducting this Chintan Shivir, and it puts in a lot of weight on all of us because the intentions of the government and intention of the industry is quite clear. Like, we have to sail together, we have to strategize, we have to retain, maintain our pharmacy of the world tag, and we have to grow further. Not in terms of only volumes. We have to create a white paper to grow in volume as well as in value. And how we would do this and how we would like to combat the ongoing Middle East crisis. Before that was a Russia-Ukraine crisis, and then it's a fast-changing geopolitical dynamics, VUCA world. India, fortunately, is quite habitual of managing a VUCA situation. Maybe it falls in under our advantage. And now today's Chintan Shivir will be focusing more on policy, strategy, upgradation, and combating all these crises which are a part of now a culture, a geopolitical culture which is evolving day in and day out. So I welcome Shri Rajesh Agarwal ji, the Commerce Secretary, IAS, Department of Commerce, Minister of Commerce and Industry, I also welcome Mr. Mohit Yadav, who is Joint Secretary, Department of Commerce, again IAS, under Ministry of Commerce and Industry. I also extend my warm welcome to Dr. Satya Prakash DL, who is IAS Joint Secretary from Department of Pharmaceutical, Ministry of Chemical and Fertilizers. And I also welcome Nipun Jain, who is the chairman for IFEX 2026. During our course of unfurling the event, I will give you a brief glimpse of what our plans for IFEX 2026. And I also welcome our dynamic DG, Mr. Raja Bhanugaru, who has been walking along with us, with the industry, and trying to create a balance between the industry and the government, and trying to take our voices also many times. And he has been now an extensive traveler because he has taken multiple delegations across the world, and I don't know how many sleepless nights he would have spent there. So a warm welcome to all of you, and let's open this Chintan Shivir from now on. Thank you, everyone.
Thanks, Chairman, for the brief and inspiring opening remarks. You all always been leading in front with a lot of motivation. All of us, you're a big source of motivation for all of us. Thank you, Mr. Chairman, once again. Now I request our Director General, Sri Rajamanuji, for his address.
Thank you, Chakravarti. Respected Sri Rajesh Agarwalji, Secretary, Department of Commerce and Industry, Government of India, Sri Mohit Yadavji, Joint Secretary, Department of Commerce, Sri Satya Prakash Ji, Joint Secretary, Department of Pharma, our District Chairman, Sri Joshi Ji, Pharmexcil, and today's IFEX 2026 Chairman, Sri Nipun Ji, the stalwarts of the industry in Hyderabad, Telangana, and distinguished dignitaries, industry leaders, and esteemed participants, and ladies and gentlemen. Namaskar and good morning to all of you. As rightly mentioned by Chakravarti ji, I think the city is known for three important things: IT, BT, and PT, information technology, biotechnology, and pharmaceutical technology, and all the leaders and who have made this industry possible here are over here. Many of them are here, and as can't take it each and everyone's name, I think I owe to them. It is my privilege to stand before this distinguished gathering at the Chintan Shivir on the pharmaceutical industry here in Hyderabad. I extend a warm welcome to all the distinguished guests on the dais and off the dais, participants who have joined us today for this important deliberation. Ladies and gentlemen, it is happening to mention herein that as soon as our beloved Secretary Commerce took charge in October 2025, registered for continuous government industry engagements, and with wholehearted support from Sri Mohit Yadavji and his team, Pharmexcil has conceptualized this Chintan Shivir. This Chintan Shivir is a part of a continuous series of structured engagements aimed at strengthening India's pharmaceutical sector. The current session in Hyderabad builds upon the success of previous editions, including the Chintan held in Chandigarh and Ahmedabad, which gave the impetus to bolster active industry participation, especially MSME, thereby leveraging the domestic and export growth targets. Encouraged by the positive outcomes and meaningful changes from these sessions, we intend to continue this format as a regular platform for dialogue and action. Organized by the Pharmaceutical Export Promotion Council of India with the support of the Ministry of Commerce and Industry, this initiative reflects a shared commitment to fostering closer collaboration between government, regulators, and industry. The core objective remains very clear: strengthen India's pharmaceutical sector and exports competitiveness through constructive engagement and policy alignment. This initiative underscores the government's strong emphasis on expanding India's export footprint through coordinated efforts with all the stakeholders. Ladies and gentlemen, I am pleased to share Pharmexcil's pivotal role in driving India's pharma exports forward amid unprecedented challenges. and India's pharmaceutical export performance continues to demonstrate resilience and steady growth. As we all know that our exports reached 30.47 billion in last financial year, reflecting a growth of 9.4% year-on-year, despite global pricing pressures and trade volatilities. And in spite of global challenges, pharmaceutical exports have been one of the few sectors that has maintained its growth momentum. And pharmaceutical exports during this financial year stood at 28.29 billion USD, reflecting a growth of 5.6% compared to the same period in the last year, led by formulations, biologic vaccines, and other products. The sector, currently valued at approximately 60 billion, is projected to grow at about to 130 billion by 2030. These gains stem from our advocacy, policy recommendations, and continuous engagement with global markets through BSMs across regions, participation in international exhibitions, and conducting on our own flagship event like IFEX. Dear friends, you will witness today the formal launch of IFEX 2026, the 12th edition, by our beloved Secretary, Commerce and Industry, Sri Rajesh Agarwalji, which will enable the participation of more than 1,000 members of Pharmexcil, showcasing their products and services, and have business-to-business meets with more than 400 international buyers for 3 days at Bharat Mandapam during September 7th to 9th, 2026. And as you all know that India ranks third globally in pharmaceutical production by volume, with exports reaching over 200 markets worldwide. Notably, more than 60% of our exports are directed towards highly regulated markets, which speaks volumes about the quality and compliance standards upheld by our industry. The USA accounts for 34% of our exports, followed by Europe, 19%. These achievements are a testament to the strength of India's pharmaceutical ecosystem. At the same time, they also present an opportunity and a huge responsibility for us to further scale our efforts, as the USP of our industry is quality, affordability, and scalability, and if I may permit it to add, even the accountability. The industry has expressed readiness to target double-digit export growth in coming years, particularly in this year, and the government continues to focus on enabling policies and frameworks to support this ambition. Efforts are being made to navigate through global headwinds, disruptions, including the present West Asia conflict, which threatened greater losses through freight hikes and road blockages, and particularly to the GCC and Vienna markets. And at home, we are continuously addressing regulatory hurdles, MSME scaling, infra gaps, with immense support and guidance from the Department of Commerce, Department of Pharma, and DGFT. At our strategies, which include fostering compliances, regulatory harmonization, and AI-driven transformation, have sustained momentum against non-tariff barriers and pricing squeezes. Our focus on quality generics, transitioning to complex therapies, has positioned us as the third largest producer by volume. Dear friends, these efforts ensure self-reliance while aligning with global leadership and vision of the nation, and are also our Honorable Prime Minister's Viksit Bharat by 2047, achieving a target of 450 billion USD in the pharmaceutical sector. Looking ahead, Pharmexcil aims for policy prioritization, market diversification beyond traditional geographies, FDA detection, and regulatory efficiency, while recommending for incentives for R&D in innovative therapies, process innovations, continuation of hand-holding through the schemes irrespective of the volume of the business turnout, trade agreement acceleration through special Pharmexcil, and digital trade facilitations to achieve the target of USD 65 billion exports by 2030. And this program, as outlined, reflects a comprehensive approach to addressing key areas such as regulatory harmonization, trade facilitation, digital transformation, emerging technologies like artificial intelligence. The inclusion of CEO-level discussions and thematic sessions ensures that we move beyond dialogue towards actionable outcomes. As we deliberate today, I encourage all the participants to actively engage, share insights, and contribute towards shaping a forward-looking strategy for India's pharmaceutical exports. With the government industry synergy through these platforms, let us collectively identify solutions, strengthen partnerships, and reaffirm our commitment to positioning India as a global leader in affordable and high-quality medicines. Dhanyavad. Thank you so much, and I wish the Chintan Shivir a great success.
Thank you, Mr. Rajmana. Moving from a regulatory landscape to a facilitator role. I think you have been a source of inspiration with all your team directors in the multiple regions. So already the Pharmexcil is making strides in many areas in serving our a big pharma sector. Thank you very much also for the elaborating the various activities. Now, may I now invite Dr. Satyaprakash TL, IAS, Joint Secretary, Department of Pharmaceuticals, a key architect in shaping India's pharmaceutical policy landscape and driving sectorial growth. So, your leadership continue to strengthen the foundation of India's global pharma competitiveness. We are eager to hear from you. Over to you, Satyaprakash.
Shri Rajesh Agarwal, Secretary, Department of Commerce, Shri Namit Joshiji, Chairman Pharmexcil, Shri Raja Bhanu, DG Pharmexcil, my colleague Mohit Yadav, Shri Nipun Jain from IEPHI. Probably very less number of sectors are there which are naturally competitive in this country. Because of market, talent, natural ecosystem we have, pharma is one of the most competitive sectors and we are also export oriented. Today we supply pharmaceutical to more than 192 countries and more than anything else to stringent regulated economies. And just to give a number, one out of every alternate pill consumed in United States is from India. At the same time, we also have that natural ecosystem to develop. 8,000 institutions involved in biologics, STEM, etc. 300,000 scientists we have who are continuously developing various things. In 2008, I happened to be in one of the laboratories in New Delhi. A gentleman told, my dream is to provide one kit for dengue at the cost of one glass of water, and today it is available at the price. So we have that natural talent. However, the target is to go from volume to value. So that is a challenge. In recent days, in March itself, semaglutide went out of patent and there are 58 companies producing it today. But the question will we be able to produce the API in India or not? The probably 2026-27 budget, para number 16, came at a very opportune time that we are searching an answer for how to go from volume to value. And today we have a government scheme or support system in everything. For example, you want to have for bulk drug, we have PLA, we have for pharmaceutical research, we have PRIP, for biologics, we have come up with Biopharma Shakti. So where we want the industry to come together and actively participate in policy making. And already we have constituted 78 different committees. A lot of you are there in these committees. So today we are going towards the precision. For example, epilepsy, hemophilia. We are working at molecule level, at gene level, so it needs a lot more precision and finding answers to the problems we have. So at this opportune time, this particular Chintan Shivir will also be working as an education material for me. Thank you for inviting me here. And I look forward for a very engaging and enterprising conversation with all of you. Thank you.
My dear friends, I think it's the time now for the day. We have the privilege of inviting our chief guest, Sri Rajesh Agarwal ji, the Honorable Commerce Secretary, the Union Government of India. The IS 1994 batch, Manipur cadre, is the current Secretary, Department of Commerce, Government of India. Few key highlights: the current role assumed office recently on October 1st, succeeding Bartwalji. His core expertise, a veteran trade negotiator. You all know you're finding him everywhere on all the FTA negotiations, including the recent USA. He previously served as a additional secretary and headed critical talks for the India-UK FTA, India-Australia SECA. In fact, we had the privilege of having him in Hyderabad when he successfully executed the Australian FTA last time, if you remember. And then the Indo-Pacific Economic Framework, IPEF, where the key focus areas implementing the India-Oman FTA, finalizing the India-UK and India-EU trade deals, navigating trade relations with the US amidst shifting global tariff policies, and for example, over 3 decades of experience across sectors like skill development, MSMEs, agriculture, power, in both the states and the central as well. For example, the states like Manipur and Bihar really work hard to uplift all these sectors, and the central government, his role is really commendable. We are so happy and very glad. On behalf of my chairman, Mamit Joshi, and the entire Pharmaceuticals, we sincerely thank you, sir, once again, and look forward to your keynote address as a chief guest. Over to you, Sri Agarwal ji.
Very good, very good afternoon to everybody in the hall today. Chairman Pharmexcil, the DG Pharmexcil, Mr. Jain, my colleagues in the ministry, Mohit, Jayaprakash, who has just stepped out, all the industry leaders who gathered here today for this Chintan Shivir. First of all, I think my colleague from Pharma Ministry already talked about why this is a natural industry which has grown very well in India. India is being called as pharmacy's pharma of the world. And to my mind, I think one of the key drivers has been the volume that we are able to produce, because India, with 18-19% of the world population, is going to be a big market itself. As we grow in income, as we grow in economy size, our healthcare expenditures are also going to go up, and Indian healthcare requirement in terms of pharmaceuticals are also going to grow. So, as it is, the domestic market will remain a key driver for growth of pharmaceuticals in India. But at the same time, building on this economy of scale, I think we have brought in quality also, and we have grown globally to become being touted as the global pharmacy, because we are able to produce generics like nobody else in the world. Our cost of production of generics is something most competitive in the world, and today, as some of our colleagues pointed out, it's actually some of the biggest market in the world in terms of volume. We are the major drivers of their pharmaceutical economies. So the pharma industry has been doing a lot of human service to the overall growth of this nation. Having said that, I think there are few propositions that I'll leave before you, some thoughts that I'll leave before you, because any growth, we live in a dynamic world. Whatever we may have achieved is a done thing, but there is a much larger path ahead. So how do we navigate that path? How we are able to take that future path ahead? And the higher we are on a pedestal, I think the responsibility is much higher, because the path is going to become more treacherous, more difficult, and we have to navigate that path. One, I think we live in a world which is geopolitically very fragile and very volatile these days. In a very uncertain world which is shifting, the geopolitics is driving the nature of trade also globally, I think there are two, three things that we need to address and address in a shortest possible time. One, I think the first prime thing that as a country we need to ensure that our domestic pharmaceutical needs are completely insulated as far as possible. How do we ensure we meet maybe 80-90% of our pharmaceutical needs within the country are met by the domestic industry, but how do we ensure that we are able to make this 80% to 90% or 90% to 100%? So you know the best, but we need to look at how we are able to completely ensure that our domestic needs, because with a huge population, 1.4 billion population in India, I think if we are able to insulate this industry, this requirement of the country in a big way, it gives as a country a much bigger strength. So what we need to do to see that whatever little we import in terms of drugs, in terms of APIs, in terms of intermediates, in terms of some other formulations, I know 100% is not possible, but whatever we can do, see that our supply chains which meet the domestic requirement are completely insulated, we should work to do, and the government is always, the Department of Pharma is always there to support you in endeavors to see that we are able to, because India is a huge market, huge population size, and we need to, healthcare is a very critical sector. So if we are able to take care of that, that will give a lot of strength, because there are many other sectors will not be able to much. Like energy is one sector, we will be energy consumers in the world, be energy consumers, but we never be self-sufficient. That's the reality in which we live in. But pharmaceutical can be one sector where we can be some amount of self-sufficiency. So can we do that? That is one. Two, I think we need to also insulate our export supply chains, because the 60 billion industry that we are today, and we want to go to 130 billion, 50% of is your export. And we need to insulate, because every country, like India, also wants to localize it. Every country which is a big enough market wants to see that their healthcare needs, their pharmaceutical needs are localized as much as possible. And that's a very good, reasonable national demand or national task that each country do have. If US says I don't want to be vulnerable in pharmaceutical sector, it's understandable. The challenge is whether it's doable or not. So the countries will keep on trying to, especially the big markets will keep on trying to make it as much as possible local, will nudge the industry to do as much onshoring as possible. And I think on margins, wherever the economics also work out, these kind of onshoring will happen. If you don't do it, somebody else will do it. But at the same time, to insulate our exports, because these will be the pressures on your export supply chains. So, but to insulate their export supply chains, our markets, we do to 190 countries we export. But still, in many markets, we are less than 10%. So can we see how we are able to deepen the supply chains? How we are able to diversify in a manner. So if you are able to capture smaller markets in a big way, it will give you the much needed resilience, because the bigger market, the pressure will be to localize as much as possible. So there will always be a trade-off, and I think that is also something that industry needs to work upon, because that will give you the long-term resilience, and the growth will be easier that you are looking at, the growth target that you are looking at, it will come through that only. So that is also the second aspect before you need to think how you do that. Three, I think as department is also working, and we need to work together with the departments to see how we are able to make our import supply chains also, because many of you are dependent on APIs, bulk drug, and other intermediates on outside countries. How do we are able to make it least vulnerable? How do we invest in those supply chains in a manner that either we produce in India or our committed supply from abroad are insulated from the geopolitics of the world? How do we do that? Because that will also remain very important. Because as we grow in size, people will target you. See, your growth is not something of comfort. It might be required by the world because they need medicines, but it is not a cause of comfort in a world which is fragmented by geopolitics. So if you want to remain strong and remain growing, I think you will need to keep on investing here also. And that's why I think the government nudge to create maybe a bulk drug park or trying to bring in API back to India, I think is a step in the right direction. And we need to work very closely with the government in order to see that our import dependence, the critical dependence in import supply chains, are reduced as much as possible. I understand it will never go down to zero, but can we do so? Because we are staying in a very geopolitically fragmented world today. And in such a scenario, I think it's more important that availability is key than the price. So we need to impact the availability, see that the availability is completely insulated. The supply, the price, and the cost competitiveness comes the next. So that is something that I think the third aspect that you all need to look at. Fourth, I think we today globally, when we go, we everywhere I tell India is like the pharmacy of the world. We provide the best generics, most affordable drugs across the world. In terms of value, value proposition that India brings to the table is the highest. But healthcare is also about quality proposition. It's also about how we build in quality and credibility. So that is also somewhere we'll need to task to see that can India reposition itself to be becoming not the drug producer in the world which is most cost effective, but also a storehouse of quality. When drug come from India, it is also a complete indication of quality and global trust. Can we build that? Can we? There are very few extreme events that we find globally. When we find some of our drugs have failed in some enemies, I think can we try to nullify it completely and create a quality ecosystem where India stands for quality, because that is a long-term strength that you will get. Once your name is equated with quality in all sense, I tell you, your resilience goes up by a multiple notches up, because quality is something in healthcare which will always remain important. So cost and quality, when there is a debate in cost and quality, I tell you, it will be the quality which will always take the cake. So can we reposition ourselves as the quality producers in the world which are also cost effective? Not the cost effect producer in the world which also deliver quality. Just reposition it bit. I think that will also help us. Fifth, I think we need to also be in sync with times. We need to move with times. If the drug industry or pharmaceutical industry is moving, now we are looking at biologics, we are looking at biosimilars, how we are able to reposition industry that we are not following this debate, we are leading this debate. How we be on the innovation curve, because we are not a small industry now. We are a $60 billion industry. In terms of value, in terms of volume, we are much bigger. So if that is the size of our industry, we need to navigate and we need to now be at the forefront of the new developments in this space rather than being just a follower. Because if we don't do that, the next phase of pharma production may not be happening in India. Because globally, geopolitics will always say diversify. Because if I am sitting in US and if I am in the US government or US citizen, I'll be talking of diversify. Why depend only on India? And that's also a very natural debate. So we need to be a cusp where we are part of the innovation. We need to work with global industry in this space to see that we are part of that innovation ecosystem and we are the front runners in that, so that we are always ahead in this race. Otherwise, with new wave of new medicines, new pharmaceuticals, new growth in these sectors, maybe are left behind. I understand Indian industry is strong and visionary enough. They must be working. I am not an expert in this area, but I assume this is something they must be keeping at the top of your mind, because it is your money at risk. As a country, we lose that value proposition or the advantage we have when a strong pharma industry gives to a country, but it is your money at risk. So you must be doing it, but this is something we need to do on a more regular, more bigger basis to create, because this will also drive the vision that I think your DG talked about, or your chairman talked about, that we need to now move from a volume to value industry. So value will come to be part of the innovation trajectory, so that we will keep on working around patents or expired patents to create the best generic in the world, but maybe can we be part of the new patents that will come in this system? Can we be that part? Because now I think the industry is big enough to partake something in that also. And if we are able to do that, that will also help us in a great way. So this is also a sixth area I thought you all need to focus upon to actually move in the right direction. I think the concept of Chintan Shivir that Honorable Prime Minister has nudged, he has been telling us, guiding us that we need to sit with the right stakeholders and brainstorm these issues very candidly. The solutions will come from within. It is not going to come from outside. And those solutions will come when we are able to create an environment when people who are experts in this area can actually speak their mind, because you never know, out of these discussions you will come or reach an idea which will be worth billions of dollars, because if you are able to work on that idea you will be able to resolve some of these challenges that I laid before you. So the idea of Chintan Shivir is to actually catalyze that kind of discussion, and I assume the next 2 hours that all of you will spend discussing some of these challenges led by your team at Pharmaceuticals, our Joint Secretary Pharma, and all. I think we are able to discuss these issues candidly, be fair, and try to see, in the spirit of togetherness, try to see that what is we can do together. Two more recommendations coming out clearly, either for the government or industry to work upon, which will address some of these challenges. All these issues are there on the table. They are not new issues, but maybe if we keep on addressing them, we will be having less issues in future. So we need to use this, and we have been trying. I think I like to commend Pharmexcil and the team behind them in commerce and pharma, that these Chintan Shivir discussions I have seen are going on across the country. I have seen one happening at Chandigarh, one at Ahmedabad. So I think it's good that you are engaging people on those discussions so that we are able to actually find some clear answers to these way forward. This is going to be very important. Lastly, I think I am very happy to be here. I am very happy to uh, spend some time with the pharma industry, hear you all also, understand some of the issues that actually influence the industry, and see that as Commerce Secretary, I'll try to work with the industry, with the pharma department to see that we strengthen industry. You are a strong industry, but we strengthen you from here on more, both in terms of value proposition, quality proposition, and the overall resilient supply chains that you build when it comes to imports and exports both globally. So thank you very much for having me here, and look forward to some good outcomes of this intensive. Thank you.
Thank you, sir. The Honorable Chief Guest, Sri Raja Agrawal ji. In fact, the couple of points you told, the industry be known as the qualitative and affordable drugs for the world. And also, industry has to learn moving with the times globally. Golden words. Sir, once again, thank you very much for that insightful and forward-looking address. Your perspectives on strengthening India's pharmaceutical export ecosystem, enhancing the global competitiveness, and aligning policy with evolving global realities are truly inspiring over the times. And they not only provide strategic direction, but also instill confidence in all stakeholders as we collectively work towards elevating India's position as a trusted global pharmaceutical leader, sir. Thank you very much from our bottom of hearts once again. A round of applause for our chief guest today once again. Now I request our chairman, Amit Joshi ji, to just have maybe a couple of questions, a round of questions before we actually move into the next proceedings. Thank you.
Thank you, Chakravarti Garu. Actually, we'll have a brief question answer session. And before we start, I think we have also done some data crunching in terms of the numbers what we have. And let's also brainstorm building in the current ongoing West Asia crisis. But
it's a small segment which may impact our numbers, but the bigger impact could be assessed by the virtue of the numbers what we have done. We have reached to 28.28 billion YTD February. Now 1 month is left. Now, if to maintain a growth of our exports to even 5%, March invoicing value has to be close to 3.72 billion. If we have to achieve 32 billion, over 30.46 billion what we had done last year, then we have to invoice in the month of March 3.72 billion. Now this value we have never achieved. Like the maximum this year what we have invoiced is 2.6 billion approximately. So it requires a certain scale of volumes to be invoiced, and coupled with the West Asia crisis which started in this month itself, it's not a promising note. Why? Because last year, in the month of March, we invoiced the highest value to US, which was 1.6 billion. On an average, we have been invoicing US around 800 million to 850 million. But then tariff hit us, and before tariff, US want to have an inventory from India, and that is how we scaled it up to 1.6 billion. So we need a correction factor of 600.
Growth of 4.5%. Now we clearly see a revenue decline from a growth aspect from 11.6% to 4.5%. But interestingly, bulk drug has grown from 2.4% to 4.6%. Now we see the shift happening. So let's not be worried about the revenue part, but because when you try to sell more of the bulk drug, the revenue will be lesser because there is a value addition component in formulation export, which is driving 74% of volume. But when you talk about volume part, we have to be very careful in terms of measuring the volume so that our formulation, due to onshoring activities, is getting rightly replaced by the bulk drug industry. And I personally feel that our next trajectory should be more on this line, that if we are able to displace due to the onshoring activity, if we are able to displace the formulation with our own bulk drug, then it's not about revenue, but it is more about maintaining our share of wallet in the global industry, either through FDF or through our bulk drug. That is the most crucial aspect. How will the value come in? As rightly pointed out by Shri Rajesh Agarwalji, innovation, which may contribute right now to the tune of 5% or 10%, if we don't escalate it to say 20%, 25%, that 25% of the innovative positioning in the global market will make us come back, or rather much higher in revenue also. So looking into all these aspects and with the ongoing crisis, I think I open the forum for picking up 3-4 questions because we don't have much of a time. And to start with, I think whosoever wants to start with. Anyone? Okay, we have a mic.
Sir, namaste. From Sarathi from Saina Labs. Our chairman Ramesh Rao is also here. If you recall, Rajesh ji, 30-40 years back, there used to be import substitution. That really helped in the industry at that time, both pharma as well as agrochemicals, TG, technical pesticides. There used to be something called TZDD, Director General of Technical Development, and also NRDC, National Research Development Corporation, helped at that time. Now, with industry doing itself on its own, but lot of importation coming at cheaper level, the import substitution become very costly. So if you want self-reliance, despite the supply chain issues, if government can help doing some import substitution, because I've seen that fact, that is. So I really request the government, all the three are here, to look into that factor, how best it can support the industry completely self-reliable on import substitution. I think I got me. Thank you.
Thank you very much for your question. Would you like to?
Thank you. I think the entire thrust of the present government on Make in India is also about import substitution. We may not be using that word import substitution too often, but if you look at the current drive for last 5 years to develop in multiple sectors through the production linked incentives, that is nothing but import substitution. Because we want critical sectors, critical supply chains to be driven. India is a huge market, it's a huge population size, and we are growing as a market in a big way. So we are trying to onshore many of these supply chains. We'd be very happy to work to see that, because import substitution in an era which is a trade wherein we are governed now by WTO rules is not a very great word. So we couch it in multiple ways, but I think government is trying to support domestic production in a big way and supporting that in multiple WTO compliant ways. We are also looking at, we are very cognizant of the fact that there are global supply chains which are not enabling domestic production of many products in different geographies because of their predatory pricing, dumping, an injury that they provide to domestic industry which tries to get into those areas. We are trying to be, if you look at our anti-dumping measures, our countervailing measures are on a very upswing in India for last 5 years. We have been very nimble in initiating anti-dumping investigation wherever industry has pointed out to any dumping which is impacting the domestic industry. And we have been very nimble in getting those anti-dumping duties also in place. So I think through a combination of anti-dumping measures, which are legal measures, sometimes using the instrument of a minimum import price to provide some temporary support to domestic industry, and also creating an incentive infrastructure for domestic production through production linked incentives or infrastructure support or some other policy support. We are trying to create ecosystem in multiple areas, bulk drugs or APIs being one of them. We'll be very happy to hear you on any individual cases or areas where India as a country we need to focus more. We'll be very happy to see what best we can do there also. Thank you.
Thank you. Anyone else? Okay, Agarwal sir.
I thank Pharmexcil to bring this kind of a shiver here to deliberate on the issues facing pharma industry. I think the industry is really facing a lot of challenges, and it's nice to summarize some of them. Now, when we talk about API industry, I think the best government can do is to strengthen the clusters. Whatever clusters are running, because there are policies in the government which are not very economical, nor it is serving the main purpose. Like, for example, Environment Ministry is asking each industry to put their own ZLD plants. Now, this putting ZLD plant is neither viable nor environment friendly. So I think the option is to develop the clusters, maybe a cluster-wise approach where everybody can be benefited. Running an individual ZLD in a pharma unit is not a very viable proposition for any company. You spend double or triple the time, triple the money, and don't really improve the environment. You, in fact, pollute the environment more, number one. Number two is there's a lot of publication of the data, the data that we give it to the customs. You know, all the figures, the value, who is the customer, what is the price. There's a lot of publication of this. Now, these are the data which is given by the industry in good faith to the customs. I don't know what authority or which government department has given them powers to publish them. You know, they are trade data. They are secret. They are secret for the industry. Now, this is something which where Common Ministry has a direct role, that why are these data being published? Now, because the pricing in every market is different. Now, the person sitting in US, he says, what is the price you are supplying in Bangladesh? He wants Bangladesh price in US. So you are killing your own market, number one. Number two, you are creating a competition within the industry, Now, everybody knows who is the customer, what price is giving.
My own fellow, different colleague will go and he will say, I'll offer you $5 less. So we are killing our own revenues in many cases. So I don't know whose benefit this publication of data is doing. So this should be looked at, that the publication of data with the value and with the customer name should be stopped. At the most you can do, country has exported these items, the total value can be something like that can be set. So these are two suggestions I wanted to give for the existing business. For the value proposition, that is something different, that can be, R&D needs to be strengthened. That is something which can be talked differently.
Okay, thank you, Agarwal sir. I think let me make a small correction. Government never publishes the data. It is the other way around. The agencies, they try to directly have an access with the customs, and the leakages can be happen. But as far as government is concerned, I don't think they are publishing.
Sir, is it a leakage? We can't call it a leakage. It is happening from the customs, which is a government agency.
So on paper, we can't claim that government is publishing it.
No, I'm not saying, but government not stopping.
Okay, I'll
I think it's a valid question that you have asked. It's a very valid and it's a constant struggle that we also face. But from a government perspective, as Mr. Joshi pointed out, we are completely against the publication of invoice level or a transaction level data in public domain. We rather in the ministry also, we don't use that data, we don't look at that data, and we don't want to look at that data because that is something, a very private transaction between an exporter and an importer. We don't want to. But we live in a human world. So there are challenges that one is facing, and I keep hearing that these data are available in the grey market for a cost. So this is something that we need to together fight it out, because from government perspective, this is a strict no-no. For our policy making also, we have very strict ecosystem within our ministry. Even if my joint secretary wants to have an invoice level data, it has to actually come up to my level. He has to take my approval and it has to go down and actually go down, and it has to, and he needs to establish why he needs that invoice level data or a transaction level data. And that has to, because we don't get into it. But this is happening. Where is the leakage? We need to fix it. So my sense is we need to come out of it together. You are in the field, you will know where the leakage is much more than where we can go. But we are very happy to work with you to see if we take these. In case there are leakages, we can even go on to file criminal complaints or criminal FIRs for those. There's not a, because we need to fix these leakages in our system. And frankly, neither the customs, nor our DGCIS, nor commerce, or nor revenue, actually we have a clear clue where it is actually getting leaked from. Some people say at the ports also, where the cargo is coming, there are multiple handlers or people who handle these cargo. There is some amount of data which gets leaked from there and which is coming back to the market. But we need to find solutions. And if you have got some suggestions around this, we'll be very happy to work on that also. Coming to your first question on infrastructure, it's a good idea. Let us have a look at it. I'm not an expert. My colleague from Pharma is also hearing you. He must have taken note of this. We'll see. In case a common infrastructure or a common solution is better in a cluster rather than an individual cluster, we should have a look at it. Because what I hear, prima facie makes sense, but we'll have to, I'm not an expert, so I'll not be able to respond to it in very clearly.
Thank you. Thank you, sir. I would like to also add one point. Generally, we are a little starved of the data analytics, and we try to explore the possibilities and try to create a strategy paper. In this course, what has happened that we have also invited and shared the data with certain multinationals, big fours, consultants, and we also have certain strong Indian consultants, like we have one of them in our forum also. So how should we balance it out? Because the non-disclosure agreement can be signed, but the priority should lie with our Indian consultants who data mine, who who can create a very effective strategy paper rather than leaving it for Big Four, because there's a lot of investment coming in through Big Four, and then a lot of data also gets picked up by the Big Fours, and then the global strategy comes into action. So if we have to really insulate, let's also explore this side of the possibility of data mining, data crunching, which can be done through our Indian counterparts also.
One is, see, any kind of consultancy or any kind of research that we need through foreign consultancy firm or Indian consultancy firm. I think one is uh, invoice level data is something that they don't need. It can always be anonymized and it can be aggregated to form a more aggregated cohort than an enterprise level data, because that is not something that they actually need for any kind of purposeful analysis. Two, I think we'll need to look towards, because wherever the data, whenever it is being made available, maybe we look towards masking both the buyer, seller and the actual price, I think. Because that's how the globe works. That data analytics is driven everywhere, but nowhere in the globe we actually, because that will actually it will create unethical competition in the market, which is not good.
Correct.
So that is something we need to actually be against, and we need to find more innovative ways to, there is a data analytics need, but largely I keep on telling my colleagues in the ministry also, we don't need invoice level data, because if I need to do analytics, I need to know what kind of drug, how much we supply to US, how much we supply. So we need more aggregate level data. Who supplies to who's the buyer on the other side? These are the things that if we need list of buyers, we need a list of buyers. We don't know which buyer is buying from whom. If we list of sellers, there's a list of. I think those kind of data, we'll need to get to those data points through mass data. Absolutely. And that is what we are trying to do in DGCIS, which comes under the Commerce Ministry, where we look at, I am trying to reduce the human interface there.
Very good.
And I'm trying to, I've taken over a modernization project wherein now I am trying to see that can this data unmasking, data analysis can happen without human interaction? Because a lot of these IceGate data comes in a format which is not easily readable or cannot be analyzed, but we are trying to use technological tools to iron it out so that individual interface is less. And then we'll try to also see that we are able to build a lot of analytics platform within DOC itself, so that we don't need to share data, we can share the analytics.
Yes.
So instead of sharing the data, so that analytics can be based on, but at least in government we'll be sure that this is based on data and nobody is actually using that data outside. So this is something that we are trying to work upon. By the end of this year, we should be somewhere nearby. So that's already a project in motion at Calcutta. Thank you.
Thank you, sir.
Hello, sir.
We are running short of time. I'm very sorry, sir. We'll take your question, but separately, because we are running very late. Over to you, Mr. Chakravarti Garu. And thank you very much, sir, for addressing the questions.
Thank you very much, sir, Sri Commerce Secretary ji, for taking your time to elaborate. In fact, we are running a little short of time. Moving on to the next event in this inaugural session. As you all know, the IFEX, the flagship event of the Pharmaceutical Export Promotion Council of India, is not just an exhibition, it's a reflection of India's growing strength, credibility, and the leadership in the global pharmaceutical arena. IFEX 2026 promises to take this vision even further, connecting innovation, industry, and global opportunities like never before. We have our dear friend, Mr. Nipun Jain, who is also championing the cause of MSME industries. He is also a colleague on the board of Committee of Administration, and has been with Pharmexcil for a long time. And he is currently the chairman of the most happening IFEX 2026. Over to him to say a few words and launch the IFEX 2026. Mr. Nipun Jain.
Thank you, Chakravarti sir. Our distinguished guests, Rajesh Agarwal ji, IAS, Commerce Secretary, and Mohit Yadav ji, IAS, Satya Prakash ji, IAS, our Chairman and DG, So this year we are going to launch IFEX by the hands of Honorable Commerce Secretary. But I just want to say 2-3 different things which we are going to do in this IFEX. We also had discussion with captains of industry in Hyderabad and especially BDMA present also. So what I feel that in the past, API industry, bulk drug industry was not too much in priority sector or not too much in focus. But this year we are trying to have more participation from API manufacturers. We will be having a different special focus area or hall in IFEX 2026 so that we can increase more of API exports. And secondly, under the ambit of IFEX, we are also having a global regulatory conclave in end of July with the support of Commerce Ministry, in which we have three basic agenda. One is the mutual accreditation. So if our units are WHO or higher accreditation, that should be mutually accepted across the world. Second is recognition of IP. So that will help us to lower the cost of other countries. And third is also the training of drug inspectors all over the world in CDSU. So these are the three objectives of Global Regulatory Conclave. And IFEX, we hope that we will have many buyers. We are streamlining the process. And as I can tell you, like this is the 12th edition, and we started this 12 years back with the help of Commerce Ministry. At that time, there was only one exhibition in India, which was foreign controlled. But now we are very proud to say that we, as a national, we have a national exhibition, and which has gone great rates. So IFEX 2026, more than 99% stalls have been sold, and we are still receiving requests. So I welcome everyone and everyone to join IFEX. Thank you.
Shall launch the IFEX teaser with the Honorable Secretary's hands. Oh, we move on to, as you heard from, we'll play a small AV as well. Thank you, sir.
India's pharmaceutical industry continues to play an important role in the global healthcare landscape. With established capabilities across generics, bulk drugs, vaccines, and biosimilars, the sector supports access to medicines across multiple regions. Pharmaceutical exports reached approximately $30.46 billion in fiscal year 2024 to 25, reflecting consistent growth and global engagement. Driving this momentum is the Government of India's decisive push to strengthen global trade through strategic policy and diplomatic engagement. The landmark India-EU Free Trade Agreement opens one of the world's largest regulated markets to Indian pharmaceutical exports, enabling greater access to Europe's 450 million consumers. Ongoing trade engagement with the United States, India's single largest pharma export destination, is being further strengthened, creating new avenues for generic medicines, APIs, and biosimilars. The India-UAE Comprehensive Economic Partnership Agreement has already accelerated pharmaceutical trade, positioning the Gulf as a critical corridor for Indian medicines reaching the Middle East and Africa. India continues to explore and expand its trade partnerships across emerging markets, giving Indian pharma manufacturers new opportunities to grow their global presence. These agreements go beyond tariffs. They build regulatory harmonization and streamlined market access, ensuring Indian pharmaceutical products reach patients faster and more affordably across the globe. Together, these initiatives are democratizing healthcare, ensuring that safe, efficacious, and life-saving treatments are an affordable reality for billions globally. Channeling this policy momentum into tangible trade outcomes is the Pharmaceuticals Export Promotion Council of India, Pharmexcil, established in 2004. Pharmexcil plays a pivotal role in facilitating international partnerships and empowering Indian exporters to navigate complex global markets. With the stellar growth of the industry, Pharmexcil launched the International Exhibition of Pharma and Healthcare, IFEX, in 2013. The momentum reached a crescendo at IFEX 2025. This landmark edition hosted 587 plus overseas buyers from 138 plus countries at Bharat Mandapam. With 620 plus exhibitors and over 8,000 structured B2B meetings, the 2025 edition facilitated business worth billions, shaping the future of global medicine. Now, we prepare for a return that is bigger and bolder. IFEX 2026 returns to Bharat Mandapam from September 7th to September 9th. This edition aligns with the vision of Bharat at 2030, projecting a $150 billion industry powered by innovation, self-reliance, and the full force of India's growing trade partnerships. Join us as we continue to lead with innovation and deliver with integrity to every corner of the globe. IFEX 2026.
Thank you very much. A round of applause for Pharmaceutical Export Promotion Council of India, the flagship event of IFEX. It's taking strides year on year, and I request all of you to take part as an exhibitor, interpret. With more than 150 countries, participation is there. I think it is the one event which we all stakeholders of pharmaceutical industry should not miss. We also acknowledge the dynamic woman entrepreneur, Ms. Priyanka Chigurpati, the Granules India Executive Director. Thank you, madam, for coming. And now, we invite you have. We also request Mr. Murali Krishna to bring the Pharmaceutical Digest, a knowledge sharing platform. Every periodically we are releasing this an initiative by the Director General Rajabanuji from the previous year, and we are congregating all the important events and activities and different knowledge information regarding the industry. It's a very value proposition for all the stakeholders. In the latest edition, I request to unveil with the Honorable Chief Secretary's hands. Thank you, Murli, and your team for this excellent initiative under the guidance of DG Pharmexcil. And now, before calling our Honorable JS, as we heard from Dr. Satyaprakash ji, we always believe these are two valuable wheels of the pharmaceutical chariot, the DOP and the DOC. We heard from Dr. Satyaprakash ji. Now we want to hear from Sri Mohit Yadav, IFS Joint Secretary of Department of Commerce and Industry, who is deeply engaged in advancing India's export ecosystem and guiding us from time to time at Pharmaceuticals as well and other stakeholders, strengthen the global trade linkages. Sir, may I request you to kindly address the gathering and give your vote of thanks.
Respected Commerce Secretary, Pharmexcil and business leaders, I'm privileged to deliver the vote of thanks. Here, I'll like to share some things from my work that I'm currently doing. Now, under the Commerce Secretary's leadership, I would say that today we are moving away from hesitations of history. As you know, today we have trade deals with almost 38 countries. Despite these challenges, we have, under his leadership, we've moved away and we are embracing trade deals with a lot with the Western countries. We started with EFTA, then we've concluded with the UK, and now with the EU. And of course, there is an ongoing discussion with the United States as well. So I'm privileged to work under his leadership in this area. Second is, again, we are facing this West Asia crisis. In this, we've been tasked by the government to every day speak to industry, speak to all stakeholders, and get feedback and try and solve issues. So a lot of the suggestions that we had got, the Commerce Secretary had already plugged it in, and then we've got a lot of actions done on whether it's reduction in duties on the intermediate products or on the RODTEP scheme and others. And lastly, on a broad level, the task given by him and the government is that we must speak closely to every single stakeholder in this. So all the MSMEs, all the enterprises who are important, it's not just the large companies. So the doors of the government are open, and please do reach out to us for any issue, and we have to work as Team India to try and achieve the target that you have already set up. So I am again thank you, and I thank Honorable Commerce Secretary for taking time out from his busy schedule and chairing this inaugural session, and we look forward to a productive session as we go forward. Thank you so much.
Thank you, Mohit for the continued inspiration. And now it's our privilege to honor and respect the dignitaries right from the chief guest, Sri Rajesh Agarwal ji, Dr. Satyaprakash ji, and Mohit Yadav ji. Request Murli to bring the mementos and shawls. I request Honorable Chairman, Mr. Namit Joshi, and Mr. Rajabanu to felicitate the chief guest with a shawl and the memento. ముందుకు వచ్చేయండి. Request Chairman to felicitate the DOP, Dr. Satyaprakash. Now I request the dynamic woman entrepreneur, Ms. Priyanka Chigurupati, to join our chairman and DG to felicitate our joint secretary, Mr. Mohit Yadav. Ms. Priyanka Chigurupati is the executive director of Granules India, needless to be told. Thank you, sir. In fact, we would like to go for a tea break now, but before that, there are a couple of formal announcements.
As you all know, we have great sessions followed by the three, especially the session one, the global regulatory harmonization and strategic pathways for enhancing the pharmaceutical exports through compliance, market expansion, and policy support. And followed by, in fact, we acknowledge the presence of our newly appointed, the additional DGFT, Dr. Sumbat Kumarji, who is spearheading the workshop on emerging developments in the foreign trade policy. Thank you, sir, Sumbat Kumarji. With your team, you present here. And also an important session followed by that, after that, AI-driven, artificial intelligence-driven energy intelligence, the strategic advantage. And then we have a concluding address from Mohit Yadavji also. So we all break for tea, and then Honorable Chief Secretary will move towards the second floor. All the press people are required to move to the second floor. And also I request the invitee CEOs to move to the holding room. By the time the Honorable Secretary completes the press session, we move on to the closed door CEO roundtable. Thank you very much, sir, for your patience. And thank you once again to all of you for patiently hearing the session and be here for this exciting opportunity.
That in March 2024, 25, sorry, because of the tariff issues, we invoiced 1.6 billion worth of medication to US alone, much above their normal sourcing. So that also will come as an impact in 2026. So that is why we assume that we will end up somewhere near to the last year achievement only. With some amount of growth comes in, it is good for the industry.
This is Swati from Times, Swati Bharadwaj. This is Swati Bharadwaj from Times. I just wanted to ask, will we be able to achieve whatever target we had set for this year?
So there is a difference between target and performance. So target was set at a higher level, like 32 billion. But now as we trail around with the headwinds, what we are facing with the crisis coming in, I think even if we are able to achieve last year revenue, I think that would also be a positive sign for our industry.
Sir, this is Ravi Kumar from the Hindu. You had recently spoken about the likely...
Sorry, could you introduce yourself, please, and use the mic? Thank you.
My name is Ravi Kumar from the Hindu. You had recently in a statement mentioned about the impact of the West Asia crisis on pharma exports. I think you had mentioned 500 million is the possible impact. What is the picture that's available to us now, sir? It's about a month since the war broke out, and we are also discussing the March numbers. So what has been the impact so far, and what is the roadmap ahead as you see, sir?
See, largely it is more based on assumptions. The figures are yet to come. If we have figures in hand, we'll be able to actually address the impact assessment, what we can do basis the figure. And by 22nd of April, we'll be in a position to have the March data. And then we'll be able to address it more appropriately. But in terms of crisis, I think I would like to hand over to Rajeshji in terms of how the government is trying to support the industry, what initiatives we have taken. And I'm a witness to it. Daily, there are 3-4 rounds of meeting with various ministries, like just to ensure that the supply chain of pharmaceutical industry does not get impacted. So I leave it unanswered to just brief the media.
I think a couple of things which I heard from media. I think one, your concern around where we land up. Yes, one thing is clear, we are likely to land up better than last year. Whether we meet the target that we had placed before that in dollar terms, looks like difficult to meet the target that we are left, but we will be in positive territory. In rupee terms, maybe we are near that because there has been a depreciation of rupee also which has happened. So in rupee terms, I think gross rupee terms, there is a growth in pharma exports also which is there. but in dollar terms will be in positive territory. How much, as Chairman pointed out, I think we'll come to know of it by 20th, 22nd April in a more concrete terms. So it's better to wait for the numbers, have a look at it. Two, I think West Asia crisis definitely it does impact the energy supply chain, and concomitant with there's some impact is coming to pharma sectors in terms of some of the intermediates that are important, some of the solvents that they need for the pharma sector. Our supply chain is getting impacted. Government is completely engaged with all arms of the governments are engaged together to see how we can prioritize the limited supplies of LPG, and that is being resolved to the largest extent possible by even diversifying our imports, by buying from other sources also. So as we are able to resolve that overall supply chain, we will try to alleviate some of the pain in every sector, and pharmaceutical will be one of the priority sectors also.
Can you switch on the mic?
Was there any discussion about the China Plus One strategy during the Shivir?
Chintan Shivir, I think, is going on right now. They will conclude it by afternoon. There are multiple ways, but I think it's more to focus upon how to make our supply chains resilient, both our export and import supply chains. As a pharma industry, we are also good importer in terms of many intermediates and bulk drugs, and also we are a big exporter globally. So to be more resilient in current times is the best way to go forward. So I think the industry and the government together will be sitting and trying to figure out what can we do more to make our supply chains more resilient, whether it's an export supply chain, whether it's an import supply chain. I think both these aspects will be discussed in depth. Thank you.
Sir, my name is Rishika Sadam. I'm a journalist with Reuters. You've talked about how there's crisis in the solvent and intermediate kind of area, and those companies have been repeatedly talking to the government about this. Given the current situation, how does the next few months look like? There are also reports about could this lead to a potential shortage? Could this lead to a potential supply shortage to pharma companies? Those kind of discussions. But if you could give us a picture on where exactly we are on that.
I think actual numbers the industry will be able to touch upon, but my sense is, see, there is a stress in the supply chain. That is something an agreed position. How much is the stress? How much we are getting impacted? Because as we go more longer in this stress, then only this pain is felt. Because initial days are met through inventories and things like that. So, but having said that, from government perspective, we are trying to ease out this supply chain as much as possible. We are completely cognizant of the challenges that the industry is facing, and beyond the whatever LPG supplies the government is able to source in through various diverse sources, we are looking at how best to support the LPG requirement in this sector also, so that some of their requirement in terms of solvents are addressed. So industry and government is working very closely, and I see it may not be able to run the entire supply chain the way it was running in the past, but we will definitely be able to elevate it in a manner that the supplies of essential drugs are not impacted.
Sure. Quick follow-up, sir. How about the import of key solvents, say ammonia and all of them, for which we largely rely on the...
I think the import diversification is always a good option, and that's why you see government came out with a host of import duties cut 2 days back, and that is a strong signal to the market that wherever we are finding the domestic supply chains getting strained, we should also look at import options to see that temporarily can we meet those gaps through possible imports. Having said that international trade itself is getting impacted in these areas, but on the margins there are multiple other geographies where these consignments may be available. So that's why we have opened up these options for the industry too.
Sir, possible to list out which geographies are those?
Wherever you will find natural gas or LPG supplies coming from, those are the supply chains, because Middle East is one of the key source of LPG, but there are other areas also which supply it. So we need to look at those supply chains.
Is it possible to quantify the exact hit?
Pardon me if there are a lot of people
Yeah,
here.
just
So if we
wanted
can
to
restrict
yeah.
One question to one person.
But people have asked multiple questions.
Then
So just, is it possible to quantify the total impact, like by how much are the, imports of these?
Touch around 38 economies. And these economies, you leave aside the United States, they touch more than $30 trillion of the economy size. So it's a huge market that we are opening up and trying to have a more engaged trade relationship with those economies. We believe these FTAs, once they are all operationalized, this will open up new opportunities for our exporters also. This will help them diversify markets. This will help them have more deeper exports on some of these markets. And this will also enable a lot of growth for our domestic industry. Government of India, different ministries are briefing media centrally at Delhi. Some of these questions, I think, through your media channels, if they are, because this is something our port colleagues in the port ministry will be very clearly. My information will be hearsay, and I will not like to touch upon that.
राजेश जी, सुरेखा टीडी न्यूज़ से मेरा सवाल ये था कि यहाँ पर कुछ देर पहले जब बात कर रहे थे मंच पर, तो आपने कहा था कि वॉल्यूम के साथ साथ वैल्यू की भी बात होनी चाहिए, और जाहिर तौर पर प्राइस की भी अगर हम बात करते हैं आम आदमी के लिए, तो इंडियन मार्केट की जब आप बात कर रहे हैं, तो क्या इस चिंतन शिविर के जरिए हो या फिर जो टारगेट्स रखे गए हैं उसमें क्या निकलकर सामने आ सकता है, और खासकर अभी जो हालात है उससे कितना ज़्यादा इफेक्ट होगा, आप जो भी आगे का फ्यूचर का देख रहे हैं उसमें कितना आपको लगता है कि कहीं ना कहीं पीछे छूट सकते हैं?
चिंतन शिविर जो आज यहाँ पर आयोजित किया जा रहा है, उसमें आई थिंक दिस करंट क्राइसिस इज अ temporary one. Right now it has emerged over last 5 to 6 weeks. So this is not the immediate area on which इसके भी जो repercussions है वो जरूर डिस्कस होंगे, पर लार्जर जो एक विजन है फार्मास्यूटिकल इंडस्ट्री के लिए कि अब हम एक बड़ी इंडस्ट्री हैं और ग्लोबली जैसे हम वॉल्यूम के लिए जाने जाते हैं, अफोर्डेबल प्राइसिंग के लिए जाने जाते हैं, कैसे हम क्वालिटी के लिए जाने जाएं और क्वालिटी प्रपोजिशन से कैसे हम एक वैल्यू बेस्ड इंडस्ट्री की ओर आगे बढ़े, बिकॉज दैट विल गिव अस स्ट्रेंथ इन द लॉन्ग रन. तो उस पर चर्चा की जाएगी, बिकॉज इंडियन इंडस्ट्री नाउ आर ग्रेजुअली ग्रोइंग इन मल्टीपल एरियाज. द इंडस्ट्री ऑफ टुडे इज नॉट द इंडस्ट्री ऑफ 10 years back. It is a much developed, much forward looking and a much more robust industry. So definitely आगे का रास्ता कैसे तय हो, क्योंकि फार्मा क्षेत्र में भी नए प्रयोग आ रहे हैं, नए इनोवेशंस आ रहे हैं, नए ड्रग्स आ रहे हैं, बायोलॉजिक्स की बात हो रही है, बायोसिमिलर्स की बात हो रही है. तो हमारी इंडस्ट्री कैसे इन अपॉर्चुनिटीज को भी साथ साथ इसमें भागीदारी, जो हमारी भागीदारी अभी तक जेनरिक्स में रही है, वो भागीदारी बाकी क्षेत्र में भी कैसे बढ़े और हम लोग वहां भी लीडर्स हों, इस पे चर्चा की जा रही. ताकि
There are many people. Please pardon us to give them an opportunity as well.
Anybody wants to ask,
Thank you.
they can ask.
No, everybody's saying go ahead.
We need to get an overall. Sir, as a Commerce Secretary, tell us what is the overall impact of trade in terms of exports and imports vis-a-vis targets for the for FY26.
See, targets are kept to nudge the industry, to nudge our ecosystem to move towards a broad ballpark. But all of us understand trade is not a one-way traffic. Trade, exports, or whether it's export or import, it depends on whole lot of things, especially the external environment. I can export only when there is somebody else to buy it, isn't it? So there are a whole lot of externalities which impact the trade, and we are completely cognizant of it. Having said that, we do keep targets to see that we are on the right trajectory, because growth is something which will give energy to our industry. Growth is something which will help them grow and look big and think big. So we keep on towards it. I think my sense is we don't have numbers. I think
language requirements. So there is still, in execution, there is still a lot of fragmentation that is there. However, with the principles being agreed on and having a common language, I think we'll see more of this going forward.
Thank you, Rahul. So you're saying, in a way, you're saying harmonization reduces duplicate work. That's one. And, but we still, one question is, we still spend a lot of time and efforts in tailoring our dossiers, right? So that's one thing which we need to talk about, maybe as we go along. My next question is to Sangeeta. Which new markets are most promising and what regulatory hurdles do you see there?
Yeah, like most of the emerging markets, like, we have like a lot of challenges and they are promising as well, like South Korea, China, Japan, Brazil, where the requirements are unique and we have to generate again additional data to meet those country requirements. And at the same time, they want the product also to be launched in India. Sometimes they want at least to be launched in some country, which if we are targeting a new product to file in any of these markets, we have a challenge because it's not approved in India and sometimes it is not approved anywhere in the globe. And also they require a specific documentation where we end up in duplicating the data, generating the data again to meet those country specific requirements, which adds on the cost, and a specific bio studies, which is again additional cost. And also like sometimes they want like valid samples for testing. They also do the testing. We have to send the samples for testing, undergoing various logistics, which also takes a lot of time in getting the import licenses and then testing the samples there. And after that, like, the dossier will be going for the review. So these are the major challenges we are facing with these, regulated markets as well as emerging markets. We have a lot of challenges, though it appears that all of them are harmonized and all of the countries say like we need ICH requirements, but still there are like unique requirements where again industry ends up in generating the data, or sometimes like we also end up in taking the fresh exhibit batches for those countries. I think I answered your question.
You did. I was about to ask you, any proposal to take care of these as we move forward. So anything which comes to your mind, how do we really tackle with this?
Yeah, only like proactive management is the only way like we can take care. Because each country requires, they need their requirement if we want to get the approval in those countries. So we only have to understand the requirement and make a proactive planning so that we can avoid the duplication. So we generate the data, like if we are doing validation, we ensure that we also do the validation as per the Brazil requirement or the Jordan requirement or the China requirement. And sometimes like for China, they want the excipients APIs to be approved in China. So we also ensure that we use the same excipients and same APIs which are already approved with the Chinese regulatory authorities.
Thank you, Sangeeta. Continuing with what Sangeeta just mentioned, this question is to Chiti Babu. I'll just add to what she said. So while we are trying to do all of this, do you think AI can help in this era, in this field? Can it really help reduce the overall timelines? That's just an ask using AI. But your question is, how is AI being applied in your regulatory and quality functions today? Now, I was trying to add to the angle what she said. If we use AI, can we really reduce these timelines? And I heard, I was reading somewhere recently in one of the news where, saying US is trying to, they have started using AI into their audits and all else, is something which is being used. They're also talking about reducing the number of checks being performed to approve the products, right? So that's another big thing. And they were talking about, using AI into this area as well. So the question is on AI, how AI is being applied in your regulatory and quality function today, and what do you see as the future of this?
Good question. AI definitely will reduce time frame for the quality functions as well as regulatory filing. But to start with, if I consider that there some kind of documentation intelligence is needed, where generally the most of the regulatory affairs folks they spend a lot of time on the documentation. So how quickly we can do the documentation, and so that probably in future we might get an AI application even to file the regulatory document submission directly to the agency, but at the same time it has got negative impacts as well. So AI applications, current AI applications will not replace the human beings. Human in the loop is very much needed. Without human intelligence and just like that, trusting the system, it might cause a havoc to the patient. Ultimately, at the end of the day, we are talking about the patient safety from the pharmaceutical company's point of view. So it is very difficult to trust it. At the same time, we see this from the cyber security point of view. It is low hanging fruit for the cyber attackers on all these AI applications. Very low hanging because your data is going outside. So when your data goes outside, any data poisoning can happen. When the data gets poisoned, you're nowhere. You're nowhere in the competition. You definitely need to shut down your facilities. The situation might come. So as of now, I say that AI is an enabler only. It cannot replace the human beings, but it can expedite the human mundane tasks that are being done as long as that particular solution is secure enough to the company.
No, you're absolutely right. So, when we talk about AI, when the AI started, and especially when people started talking about AI into pharma, there was a stage where, the accuracy level was being questioned, saying, initially it was generative AI and it gradually moved to agentic AI. And, the accuracy, even today, people talk about accuracy. Look at Amazon and others who are talking about 92% accuracy level. Now, there was a stage when people were talking about 85% accuracy level. But of late, I have seen the accuracy level, especially for AI, some of the companies talk about even going beyond 95% and touching 98%. But yes, definitely, human in loop will continue to be there. Decisions can't be done by using agentic AI or any other AI. So human has to be there for taking decisions. And as you rightly mentioned, the most important part is looking at the time reduction, which AI definitely helps. And I have seen live examples of those. When it comes to pharma, the first question asked by the pharma teams are, how many people can I reduce? Because pharma looks into number of people getting reduced even today also. And rightly so, the challenging times forward. But I think AI will be put to use, if not today, maybe 5 years from now. And it is definitely going to help. Let's see how we...
Let me add that.
Yeah.
See, you brought the right point. Again, the hallucination and biasing.
Yes.
How do you eliminate the hallucination and biasing is the critical. If you don't eliminate that, then the purpose of AI is totally lost. Right? Again, the reason I always say in a lot of my team members as well as the other conferences, humans, AI can never replace human. Can you ask AI to taste the food and say, what is it? How does it taste like? The human emotion is totally cannot be replaced. And there are certain theories are coming that the AGI is going to come. It is artificial general intelligence. Whatever we are talking is completely narrow AI today. So AGI might come, but it may take, from my point of view, it may take several decades, maybe beyond 2050 or so. We never know. The technology growth is rapidly happening. We never know at what time it comes.
A good point to discuss offline. So you made a very valid point. So coming back to you, Rahul, my question to you is, from your experience, which compliance gaps most often delay Indian exports, and how are we going to address these kind of gaps? Especially from export point of view.
Correct. Yeah. When I look at the compliance gaps that happen, most of them are not on the strategy side, at least for regulatory or compliance, but more on the execution side, I would say, where we're looking at weak data controls, or you're looking at poor audit trail reviews, improper CAPAs. And I think the execution side of it has to be very strong. And most of the regulators are also not allowing, earlier we used to be in the state where documentation will catch up with compliance. And I don't think regulators are actually agreeing to that now. They're being much more stricter on documentation, data governance, and control. And I think this has to essentially be embedded in the design much earlier. I think we have to be ready by design rather than as a forethought, right? For that, I think one, you would need to look at your master governance itself and your data level controls that you have in place to ensure that you're ready by design. Second, I think you cannot treat audit trails and reviews and inspections as, let's say, cost of doing business. That has to be ready by design, I would say. And third, you would also look at your own, I would say, governance within the organizations, the quality systems that you have to ensure that you're always ready for an audit or any regulatory requirement that is there. In terms of delays where they're happening and how the compliance gaps catch up, actually, with more complex products being coming out from India as well as China, and products like bio.
I think uh, if I have to add on the compliance side, look at the recent trend of the last 5-10 years trend for the audit observations.
Right.
I'm just adding to what you just said.
Right.
Look at the areas where the normally the major observations have been around. So investigation is one of the areas. I've seen it getting repeated almost every year or every 2 years. You can find that as one of the big areas where it's still not being accepted well by FD or any bigger regulatory. Same way, the cleaning and all these things. And also, someone talk about the capability of the people. So these are 3-4 big areas where the pharma industry, people have been looking at solutions for this. And when it comes to, again, putting a use to AI, we're talking about giving solutions to them on all these fronts using AI.
Correct.
But how far that acceptability will come, how fast it will come, and how people put it to use is something which we need to look into to avoid delays again.
Correct.
Yeah.
And I echo what Chittibabu Garu said as well about AI. Ultimately, the right systems and processes have to be in place for AI to work in the organization.
Yeah.
Just adding an AI layer on top of your organization with improper, I keep emphasizing on the data control side, but improper data controls, improper, I would say, governance processes or systems in place leaves your organization open to a lot of risk. And data, as you said, once it is gone out, once let's say your LLM models are trained on your data, right, you have no control over it anymore. And that's why I think we're seeing a lot of caution in adopting AI platforms or AI tools as well. But it is a great tool, nevertheless. I mean, there's no doubt about it. Will it help make things faster? Yes, of course. But we still are being cautious in the use of AI right now.
Absolutely. My next question is to Chiti Babu. If you are advising a mid-size exporter, what 3 practical steps would you recommend to leverage AI for compliance and for market expansion?
Okay. First is for a mid-size companies, they should concentrate on the digitization. So again, digitization also there are 2 words: digitalization and digitization.
Yes.
So if you are using some kind of analog platforms, you should convert them to digital platforms. Then subsequently, the outputs that are coming from those equipment, they should be digitized, not the. I'm sure for most of the pharma companies do have legacies, SCADA system still going on. So we need to, again, replacing them with the latest and greatest technologies is not an easy task. So how do we capture the data from the PLCs and coming back to the digitizing your batch records, your quality control records, etc. That is one aspect. So that means identify the areas where that need to be digitized. That is the first one what I see. Second thing is implement Of course, again, we also need to be at par with the current trends with other the pharma companies that are coming here. So then the narrow down your applications, implement your AI applications, or identify the low hanging fruits. So that's what I say. For me, from pharma point of view, immediate low hanging fruit is your predictive maintenance of the equipment. That is the first one where anybody can look at into that. Of course, that also get validated, but identifying and the or predicting the downtime and doing the maintenance right away will definitely reduce a lot of your production losses. What I say. Third is, as of now, today, still it is not available. Everyone is speaking about that. The governance. How do we govern those AI applications is not done yet. That is definitely the next couple of years. Every company will be speaking about AI governance. And what I feel is even the AI applications, how it needs to be validated from the computer system validation point of view, that is also not clear. These things need to be established before making use of AI.
No, you're right, and even if you look at from technology perspective, the era when we started and the era where we stand today, the speed which the technology has changed and evolved. I think the capability has not been built accordingly, right? So while technology is changing every 1 year or 2 years, you find the new technology coming in. Let's say in oral solid, normal granulation to wet granulation to boosters to now we're talking about continuous manufacturing. Those kind of technologies are changing, and same way in other areas. But the capability has not changed and moved accordingly. By the time we start training them in pharma, the new one is knocking the door, right? Same thing is happening with AI also. Right. So important would be, even for mid-sized companies, important would be to build capability around all of this, and to make sure that we are at par, at least 80% at par with what bigger industries are doing. And how can we really do that is important, is to build capability. That's a bigger area, and a gap I see as per my experience of pharma. So I see that as a big area. I think if we focus on that, that also can help. So thank you, Chiti Babu. My next question is to Sangeeta. In the next 3 years, what will be the single biggest change you expect in how AI helps India pharma exports?
Sir, like right now, US FDA already started using AI for the GMP inspections, because previously when they used to come to the facility, see the data, and out of the data they used to give questions. Now it has entirely changed. They are asking the complete set of data before coming to the inspection, and they are asking the trending data from the industry itself. They are asking like what are all the deviations you had, what are all the change controls. They are asking us to make the data and applying the AI tools and finding out the problems. So it is going to be a very challenging for the industry. Now they are also going to apply the AI tools for review of the dossiers. So when they apply this review of the dossiers and start comparing the dossiers across the industry, so industry is going to get more and more questions. So we should be ready for that. That is one more challenge. And at the same time, like when we want to adapt this AI into our regulatory system, definitely it is going to be an advantage. But at the same time, as Chitti Babu sir has told, it's not going to replace the human role. Finally, it has to be validated, and we have to review it, like whether it is coming out good or not. So review has to be done by the humans finally. But however, maybe compilation, we can take help of the AI tools, so that like it is going to reduce the time, because usually we take 3 to 6 months for compiling a single dossier for the regulated markets, which can come down to 3 to 4 weeks by using the AI tool. And at the same time, we can take advantage in the terms of labeling, in terms of translations, in terms of like post-approval changes. This is going to remarkably reduce the time, because even in the field of pharmacovigilance, where we collect a lot of historical data, and all the signals, so much of adverse events, so much of tracking happens. So this is really going to help the industry to lessen the time for the quicker approvals, because even FDA started using AI tools, and when we also implement this, so definitely I think even the review period also will reduce.
Absolutely.
And we might get approvals like, maybe in the fraction of 6 months also. Right now, like we are taking, sometimes it is more than 1 year. So that might reduce. So that might be a big challenge to the industry, as well as a big change to the industry, which is going to help as well as create a challenge.
I agree. So, I'll just add an example, two examples, live examples. As you said, it reduces time. For a normal batch record review in pharma industry today, it takes around 48 hours minimum to 72 hours. And, I have a live example where we used AI. It did that review in 1 hour, right? Now, but a big list of observations coming up, and people have to address those. It's important. Similarly, one of the company, shared an investigation saying, we have done this and all. And when AI investigation review was done, that investigation didn't stand anywhere as compared to what AI did. It was going bang opposite to what, the observations were given by the company. So these things we have to be ready with. We have to make sure, and those are right observations also. They agreed finally. But important is how do we really, teach our people, how do we coach our people to adopt to that, and how do we really differentiate between what human is doing and what AI will do as we go forward. So thank you, Sangeeta, for your question, response. Coming back to Rahul, regulators accept AI-generated validation reports only if the model is validated and explainable. How do you validate the AI model when the algorithm itself evolves with the new data? And I'm sure who signs off, whether the QA or the AI, what will be accepted as we move forward?
No, that's an interesting question, actually. I think in terms of who validates the model itself, right? I think that has to be the responsibility for explainability of the data, the responsibility of, let's say, being able to validate the model, validate the training data, as well as a continuous validation of an adaptive model. If I look at it, currently the models are learning from the data and then coming up with new algorithms as well. And so hence it is a continuous action that happens, and the responsibility of that would lie with the QA head. While the digital, and I'm also part of that same team, right, can build the models, can develop the tools or the platforms, the responsibility for ensuring that these models are being validated, they're explainable, they're within the guidelines that they've been set, the protocols for validation that are set, and also looking at the training data, so to eliminate bias. That is going to be the responsibility of the QA person. Of course, with help from the digital team. But what I would back away from is letting AI take the responsibility for that. I don't, in the current scenario of where we are and acceptability by FDA or any of the other organizations, an AI being responsible for the output is still not in place. There's no way to have them validate their own algorithm and then come out with what is a bias, what is the hallucination that is happening. And hence it will always, at least for now, continue to have a human in the loop, ensure that the QA head is the one who's actually taking responsibility for that information. That being said, there's a lot more advancement in AI that's happening as well, so that when you have an agent which is working on the data, it's no longer a single agent that works. Actually, you have multiple agents which are actually cross-validating each other. So the explainability is actually it's getting better, actually, I would say, because of that. Each model is able to explain the other model's explanation, the guidelines and the protocols that are set, and hence it is getting better, but the responsibility would still continue to lie with the QA head for the system.
No, you're right. On the lighter side, when the batch record review was being done AI, the batch record size was 400 pages. the strong AI generated report was 194 pages. Now, reading 194 pages itself will take time, though we say it has taken 1 hour to generate the report. But, 194 pages, people have to read again word by word and pick up and say what can be done. But then again, it was squeezed down to few number of pages with a summary and all. So these challenges are going to be there as we move along, but we have to really make sure that we come out of this stage as well.
Correct.
Yeah.
And if I look at it, the best adopter of technology, right, is actually not within, I would say the pharma organizations for now. It is actually in the area of banking, in the area of education. So we will, as we actually increase the usage of these tools, we will see parallels being done in industries which are more disrupted by technology, and we will have a learning curve to it as well. That being said, I think the other major adopter of AI is actually children. Let me be honest. If I look at it, the number of tools that they adopt. For example, my daughter comes up to me and tells me, "Dad, I've discovered this new tool. I want to use this." Now I have to be careful with her, but still, I think that's the generation which is going to grow up AI native. And as they come into the industry, as they come into working with organizations like ours, they will expect that we are already native in these platforms and tools. So capability development, the guidelines for using AI, all of that is going to be much more relevant, and also the governance around these systems is going to be much more relevant going forward.
Absolutely. And thank you, Rahul. My next question is to Sangeeta. Chasing harmonization sometimes means upgrading facilities to the strictest standards like USFDA and others ask for it, which raises costs and prices, potentially making us less competitive in price-sensitive markets like Africa. African market is a big market for pharma, but there the price competition is the biggest one. And how do you balance higher standard compliance with market-specific pricing?
Sir, it's really a challenge. But when you have a facility and when you are producing the product for all the countries, we can have only one common system. So your quality system cannot be different for each of the country. So which we are already following it. So yes, definitely it is a challenge, like following all the compliance systems and meeting the competitive prices. These two are two parallel lines which never meet. So in order to satisfy the agencies, we have to meet the quality expectations. But when any FDA auditor comes or any European auditor comes, you cannot have like two systems having in place. So harmonization anyway, it helps because it can avoid duplication, because when you are doing the work at one go, so it will really help the industry at one way, but at the same time it is also a challenge to meet the prices. So it's a really very sensitive question which cannot be clearly answered, because we know that always whenever the agency comes, any auditor comes, gives observations, it results in upgradation of the system, adding more SOPs, more systems into place, more automation into place, which obviously adds the cost to the product, but the market never gives the price to you, because always you meet the competition. So the agency is only behind us to meet the requirements, but no agency gives you the promising of costing. So that's a different game, and this is a different game. So if you want to be in the market, you have to meet the requirements, and you also have to be competitive. So we only have to find different ways of reducing the cost, harmonizing the systems, whichever is going to benefit our pricing.
Absolutely. So just to support you, what you just said, let's say a company takes care of US market in larger percentage. Rahul, I'll not name the company, and along with emerging markets and India market as well, right? Now, when it comes to quality system, as you rightly mentioned, expectation is that the entire organization should have same quality system. You can't differentiate whether it is India market or European or African or USFDA. But when it comes to looking at the benchmark, saying cost dollar per thousand is something which Provo's benchmark has brought in. People talk about look at dollar per thousand. It is $5.2 for US market, $3.8 for European and another market, and $2 for India market. Now, expectation is that you should have similar quality systems, same quality systems, but the pricing should be different. So one way which was thought was saying, okay, can we move India market products to third parties? At least there the pricing will be less, maintaining our controls and all those things still. But yes, it is a bigger question. How do we really take care of the pricing part? I think the companies have taken certain steps in this direction. I'm just trying to support what you just said. So rather than adding AI or these kind of systems and all of these, which will definitely increase some cost to them, maybe they can continue to do what they are doing. The benefit is the overall reduction of the approval time. The approval time in African countries, while as compared to US and Europe, slightly lesser. So all these things put together, maybe it can help reduce in addition to what you just said. Coming back to Chiti Babu, large players like Reddy's or Aurobindo can invest in AI-driven regulatory platforms. What about mid-sized exporters? Is AI-driven affordable for them, or will it widen the gap between big and small exporters?
Yeah, as I mentioned, the data is very much important and it should be secure enough. So we are developing AI applications within four walls of the company. We do not want to expose any of our data beyond four walls. Okay, the several vendors started coming that said we only take metadata, we will not work on data. Again, metadata is also data about data. Where is the guarantee that metadata will not carry the proprietary information of an organization wherever that AI is being deployed? There is no guarantee. And so what we need to do is for the medium and small enterprises, they should depend on obviously the cloud providers, the GPU providers, wherever their application has to be developed or deployed. The only way is they have to separate technically. They should be, all these applications should be kept in demilitarized zone. They cannot directly interact of any of the real-time applications. When they do the DMZ zone, then security can be established, and on the top of that, the cybersecurity, robust cybersecurity solutions need to be provided, because attackers are more intelligent than us. They are already using AI. Okay, their AI is focused AI because they only need to attack. So they do not have any diverse, too many business functions. It's very easy to attack the application. For example, just I'll give you a quick example. If you are SCADA, all those SCADA, they are operational technology because they are intended to do only certain function. So easy to attack them. That's what they look at it. Thus, your SCADA system should be separated, your AI application should be separated, your OLTP application should be separated, and provide robust security. Then they can use it. Obviously, they should depend on some cloud providers, no doubt about it. With all these securities, they should be able to do that.
Yeah, I agree. So we should also, kind of coach them and handle them. How do we really make use of AI? That's one. And, what part of AI is beneficial for them rather than, and someone should be able to put a cost to it, quantify that, saying how is it really helping, so then only they'll be able to visualize saying, is there a benefit?
No doubt GPUs are expensive, but I was told, because I read some article recently that India GPU data centers, they are providing at 100 rupees per hour or so, which is definitely economical for a lot of enterprises. But we need to identify those data centers and use those GPUs.
Thank you. Keeping time in mind, I think this will be the last round of question. I'll say you have to be a little faster. Over to you, Rahul. So the government is pushing AI adoption. This is more on a government support. So the government is pushing AI adoption, and we saw, that get together happening in Delhi, but we don't have a CDSO guidance document on AI yet in regulatory submissions. Should the government issue such guidelines now or wait until industry practices mature?
I think first I want to say the government of India has definitely done a lot for AI, push towards AI adoption in India, and also a push towards AI capability building in India as well. I think the recent summit, as you mentioned in Delhi, was a showcase of that. I think the talent that was on display, the different platforms that are being built, it was really wonderful to see. And I think credit to the government who has actually helped push this across as well. They've definitely taken the importance of AI in industry, in development of the future development of India as well. That being said, I think right now with CDSCO guidance, I think we do need more immediate action on it. I think there is a lot of work that is happening on AI and tools being built on AI for regulatory submissions, for compliance, that people are still not sure of whether it will be accepted by CDSCO or not going forward. So when it comes to validation, when it comes to electronic batch record submission, when it comes to life cycle validation. So each of these, they have to ensure that the guidance is clear on what is the human oversight, what is permissible by AI to be done, and hence that can be, and this will help mature the industry process. I don't see it as strictly one way. I think the industry process will evolve to meet those guidances as well. Right? And it will be a work in progress. I don't expect the first set of guidelines to be a perfect set of guidelines.
Yeah.
And there will be discussion, there will be further debate and growth and evolution of those guidelines as well.
I think, you made a point, and especially our DCGI, Dr. Rajiv Raghuvanshi, being from pharma background, and we have seen him working in this direction a lot. I'm sure he must be looking into this as well. While FDA has issued guidelines very recently for industry to adopt, while a lot of questions are also being raised, and if you look at the guidelines, it says if it qualifies, how do you qualify? So those kind of wordings are being used. But I'm sure DCGI also must be looking into this as we go forward. But it's important. It's very important for us.
And FDA has had a lot of experience working with real world evidence as well. I think that has helped develop the guidelines for them. We would be well advised to look at the guidelines that FDA has given, that EMA has given, and adapt them for Indian usage as well.
Yeah. My next question is to Sangeeta. AI models need large volumes of historical data, historical batch and cleaning data. When we use AI tools hosted on foreign cloud servers, how do you address India's DPDP Act 2023, right? And the risk of sensitive formulation data leaving the country. So maybe Chiti Babu can also add to this if he feels so, but it's more for you, Sangeeta.
Yes, sir. So definitely meeting this act would be really challenging because usually whatever AI tool we'll be using it, we have to depend and we have to share a lot of historical data. So the data will be on the foreign cloud, and we are not sure whether these foreign countries, the software providers would agree for this act. So how far this is going to be successful in implementation, we have to wait and see, because definitely there is a risk of sharing confidential data, which is like most of intellectual property of the Indian companies, so which will be at stake if they don't adhere to this act. So definitely this is going to be a challenge which we have to see in the future, whether the companies are going to take AI tools to share this historical data on these foreign clouds, and whether our government is going to allow this, or whether the agencies are going to obey this law. So definitely this is going to be a challenge, sir. We have to wait and see over a period of time, because whatever the data we generate, it's very important and critical data. And most of the time, we will be including all the complete data, starting from the development to the life cycle management, where if this data, as sir said, always, there is a threat for cyber attacks. So that also we need to ensure, because more of secured systems are required, and even the companies also to agree as per our act to function in the pharma industry.
Yeah.
Sir can add to this, because I am not a
I have
expert.
another question for him, so he can add to that. Okay. No, but you're right. And specifically, if you look at from the recent cyber attacks, not recent, the last 3-4 years, if you look at specifically on the pharma industry, I think that was a good learning. And people in pharma industry started to think about using AI into development also. Digital first and then comes AI, right? But looking at those cyber attacks, they have taken a back step saying, okay, let's not really venture into a R&D part of it, because if this goes, everything goes, right? So that is still kind of more of a manual and a standalone systems which controls R&D data. But I'm sure some point of time this also will come up for discussion. So the last question to you, Chiti Babu. Global harmonization sounds ideal, but in practice we still see the USFDA demanding 21 CFR Part 11 audit trails, EMA asking for Annex 11 specifics, and some African regulators wanting paper copies. How do you reconcile true harmonization with this reality? Because all the three scenarios will still exist. Is it actually achievable, or should Indian exporters just plan for multi-track compliance? Sangeeta can support on this part. So.
Yeah, it's a good question. So one, definitely, as I mentioned, you cannot go with single the solution at any point of time. Otherwise, it is a single point of failure.
Yeah.
So it's very difficult. So we have to have, in fact, rather than the question related to whatever Sanjay madam you asked about the data residing in the foreign servers. If you see the current trend in India, not only in India, everywhere, so many data centers are coming up within India itself. So you should come up with such a application where our vendor should identify a vendor where they can develop and deploy within local data centers by taking the GPUs and etc. That is for me, from technology point of view, that is a low hanging fruit. So it addresses or caters to the both large enterprises as well as small and medium enterprises. That's how. The second thing is, you asked about the audit trials and etc. For me, even today, it is a very difficult to answer that question technically. The reason I said today we are talking about agentic AI. See, generative AI has come, then after that AI agents have come, now agentic AI has come. Rahul has brought a right point. I don't know how many of you caught that explain. So tomorrow we will be getting explainable AI, then followed by responsible AI. So they are yet to come. Now, when agentic AI is nothing but it does the autonomous transactions in the system. When something happened, your AI got corrupted, your data got poisoned. How do you make sure that who is responsible for that? Is in an application the say like technology team like CIO is responsible for the data corruption or your audit trail, or the agentic AI triggered by the quality people or regulatory people, are they responsible? Are the vendor responsible? Are company responsible? But at the same time, if an auditor catches hold of that particular anomaly, he will sue the company, not the individuals. The company gets impacted. So these things have to be taken into consideration. How do you really look at the audit trail of agentic AI? For me, even today, I could not get the right answer from any vendor. Any vendor, they say that we have got this application. Then what is the audit trail? Is it an independent individual that has triggered agentic AI? Let us say you have triggered an autonomous transaction at evening 5 o'clock. I went home. Right? Now, the transaction, after so many autonomous operations, transaction occurred 10 p.m. I was sleeping. How do you expect me to take the responsibility of that? So these are so many things that need to be answered, which are, as of now, technologically, I could not answer myself.
Yeah, and people talk about having their own server. Someone says cloud is a better option, safer. And how long cloud is going to be a safer option, we don't know. But
I don't know whether anybody has read the recent article or not. One of the developers started using AI application within a large enterprise, and that application, that generative AI application, has erased the entire company's data.
Yes.
And identified that it itself identified that it has erased data, then it dumped the fictitious data, which is no more useful for the organization. You cannot avoid that. How do you think that we need to take such a big risk that at the closing thing, I'll tell you, I always tell analogical technically, the AI is nothing but application of statistical algorithms. On the top of that, then they'll be trained and do that specific algorithms. If you think that AI is nothing but a palmistry, if a palmistry, what a palmist does is he always identifies some patterns of the lines and he'll give you the predictions. It may be true, it may not be true. Same thing is with AI.
True. I think same way, if you look at OCR also, OCR is one thing which we say, if we can read doctor's written prescription, why can't OCR read what is being written by pharmacists on the shop floor? But that itself is a challenge. It's still going on. Accuracy level is improving. I'm sure other side also will improve. So, thank you, all of you. I'll leave it for the audience too. If you have any questions, maybe we are late by another 5 minutes or so, but still we can take two or three questions at the most. You can name to whom are you putting the question to? To me? Okay.
This Saradi again. Since you worked in both formulations and granules, Hyderabad is best place for the pellets, pharma pellets. Where you see the position itself in formulation part or the API part? Is an extension of API. And to Chitti Babu sir, see what is the cost of applying AI in the documentation? When you see the maintaining so much security and when you are depending on the external agencies, there is always risk. What is the cost of it? How much? Cost in not only economic wise, what is the cost of reflections, damages? To Amma, for you, see, you said, the one rule for the Brazil and Visa, one for Jordan. Why can't it, like ICH guidelines are there? Likewise, there can't be any global regulatory documentation so that it is easy for us. Suppose I go for Envisa, okay, fine. Then I go for Covipress, totally different. Africa, totally different. In Africa also, there are many. Ethiopian is different, Jordan is different, MENA region is different. So it is adding to cost. And we are not, it's not economically viable to product. So what do you say, sir?
Okay. First question, the response is formulation. We must focus more on the pellet side, on the formulation side. Sorry?
Sorry, Hyderabad is done for the
Hyderabad is, yes, please. Maximum pellet transactions happen in Hyderabad only. And, I'm sure all of us are aware of the name of the companies. Granules could be one, Reddy's is the biggest one. And there are many more players who are dealing into pellets part. And I'm sure market-wise also you are aware of which market absorbs the maximum pellets and all. Russian market as well as, the coming to India market and the US market. So these are the ones. So your question was, should we focus more on formulation or should we focus more on API? Formulation. No, companies have been performing BE studies. It's not that. No, you are saying more for API, you are saying? But I'm saying for capsule and all, Sangeeta can answer this more on BE part.
Like usually like pellets, so pellets, yes. So, but pellets are going to go for the formulation because the next step is they are going to fill it in the capsules.
Yes.
So you have to, because unless and until pellet, directly the bio study will be done on the capsules, right? But the pellets are the major ingredients into the capsules because they're not going to add anything. So
not only capsule now, these are being compressed for tablets also.
Tablets also. So based on the dosage form, they are going at if it is a tablets, maybe the vendor has to do the bio study. But usually when we are selling the pellets, the vendors are coming up for the BE requirement because directly if you are filling it in the capsules, So the pellets biostudy will be useful for them to conduct the biostudy. And the pellets are categorized as finished product in by the most of the agencies. Like even a pellet manufacturing facility has to pay the fees and it has to qualify as a finished product manufacturing facility. So it comes under the part of the finished product manufacturing because once the API is mixed with any of the excipients, it is categorized as a finished product. So it doesn't. Yes.
Can we answer the remaining question maybe afterwards? Can we allow others also to ask? So unless you want to do it faster and
I'll ask is cost. When it comes to documentation intelligence for any of the already filed documents, somebody has to respond that based on some query has come from regulatory authorities. Probably with human, it may take 3 to 4 days based on your previous history and etc. With AI, with properly built AI application, it should not take more than 30 minutes, where you can save that much amount of time with all the scientists, especially regulatory affairs people. I know that how much of time they spend without due to lack of this kind of application. That is the ROI what we see. But at the same time, we also need to validate that particular application for any kind of hallucinations or poisons. We should not expose that application. Do not expect that to the regulatory file submission. But tomorrow or future, we are going to get a beautiful application where directly it can even submit the regulatory file sets. That's where you can save a lot of time.
I'll talk to you on the ROI part maybe during the lunch break. I'll give you a lot of examples. Okay, the next question, the second one and the last one.
Yeah, my question, I am Rangarao, I am a supply chain consultant. So one of the biggest challenges is the manipulation of the data. Without doing any experimentation, AI can generate some results. So how to make whether it is a fake or real, that one.
Rahul, you want to?
That's where humans need to validate the data. Without even validation, that application, especially in the pharmaceutical companies, you cannot deploy any application. We need to verify the data. Data is one good thing is most of the pharma companies, because of the frequent regulatory auditors, the data is quality. The quality data is already available in the system. So then whether that's the reason I said we should have a dedicated application within 4 walls of the company. Then this question will never arise.
Correct. And detection of fraud data and fake data, I think FDS, the ELSA tool itself is actually coming up with ways to detect these as well. These can be now, we can within the 4 walls of the company also, you can deploy such agents which will help with this kind of fraud detection. You don't need to take it from outside agency.
Even today also, I'm sure when we have manual documents, there's a lot of data you normally feel it is a, fake data or whatever, but we still find out, right? Same way, as he rightly mentioned, it has to be qualified, validated. Unless you do that, you can't put it to use. And as he said, there are tools available now, which we can put into use to identify whether it is a fake data or a real data.
Thank you.
Thank you. I can see Krishna saying your time is over. So thank you, all of you. Thank you. Thanks, nice panelists. All of you answered very well, and thank you for taking my questions.
I would say a big round of applause. Sir, thank you so much. I would request to be there for some time. I would like to do the honors. I believe with the kind of discussions what we had, I didn't see any session better than this. The thought-provoking discussions or deliberations, whatever they have, is going to be useful for everyone present here. I just came to tell you the time, but I was sitting and listening to you. That's the kind of deliberations that are happening here, and from the bottom of my heart, I would like to thank each one of the speakers present here for such a wonderful discussion today. And it would be our honors to grace you with a token of appreciation. I would request Chavanji and also Akshayji to please join us in honoring the speakers. Akshay ji and Chevan ji are the joint DGFTs of Hyderabad. Madam. Rahul ji. One group photograph. Chitti Babu garu. It could be a perfect.
One more please, sir. Send the camera. Thank you, sir.
Thank you so much for joining us today. Thank you so much. Thank you. Thank you, Chitti Babu. Thank you. There's a slight change in the kind of the session since Sir from DGFT is in CEO discussion. So we will have the discussion on AI-driven intelligence now. The strategic advantage. We have with us Sri Rachit Agarwal, co-founder, partner, and chief product officer at Jolways. Did I spell it correct? Okay, thank you. So I would now invite Rachit ji to kindly take over the session and enlighten us on how AI-driven energy intelligence platform enables pharmaceutical organizations. Please, over to you, sir.
Hello. Yeah. Hi. Good afternoon, everyone. Thank you to Pharmexcil for giving us this opportunity to present the current problem statement, which is decarbonization of pharma industry. And Julewise, as an organization, has been working consistently across the industries to help them decarbonize, and AI of late has been the key sort of pillar, one of the pillars in expediting the entire process. So when I talk about decarbonization of pharma industry, typically these are the buzzwords which come to our mind. How can we sort of align to ESG mandates? How can one fulfill the SEBI norms, ISO standards, and net zero goals? So the technology, the platform, the solutions are designed specifically to address energy requirements and energy decarbonization. Yeah. So why decarbonize? As we have all known since the morning, and India is the global supplier across the pharma value chain, and the rising carbon emission cost, energy cost, and wastewater footprint are the key issues which I'm sure all of you may have witnessed in your factories, in your plants. And the regulatory shift towards ESG mandated by SEBI, EU guidelines have sort of percolated to every level. It is not just the listed companies, but also the SMEs which are subject to compliances by their channel partners to ensure that they follow sustainable sourcing and the total energy consumption and energy intensity data is maintained and shared. Hence, embedding ESG sort of principles are now a requirement, and that is what we sort of provide solution for. So how do we do it? So there are two parts of the value chain that we look at. We stand in the factory and look ahead of factory, which means outside the factory you are buying power from either grid or some other sources which have a very large footprint of carbon. When you stand inside the factory, you are maybe using heat from which is generated through boilers using gas or coking coal or wood chips, which is again a source of carbon. And at the same time, it is by virtue of the fact that it is in India that coal is a relatively expensive source. They are more expensive as compared to renewable sources. And this is how the solution has its foundation, that we basically not only replace the carbon emitting sources of power and heat with less carbon intensive sources, but also reduce the cost during the process. Now, how does AI come into the picture? So that's the sort of beauty of the solution. What we do, we have developed a framework. It's called PIO framework. We sit on the drawing board with the concerned sort of managers of the factory, and we adopt the strategy of plan, implement, and orchestrate. What does it mean? We basically plan how the decarbonization process is going to go on. We do that through a certain process. I'll just explain in a minute. And then we implement the process for you as well, not just give you some consulting report and move away. And once implementation is done, on a 15-minute level basis, we actually orchestrate the entire energy or decarbonization process with your plant managers. So let's look at how we do it. The key driver of this entire process is the fact that our government, Indian government, which is one of the most progressive in decarbonization driving decarbonization, has allowed open access. Open access is a concept which is allowed regulate by virtue of a regulation, an act. It's called Electricity Act 2003. Any consumer above a certain threshold capacity can buy power from anywhere in India. That's the basic foundation of this entire process. So for example, I am a factory in Hyderabad, Kolkata, Patna. I need to apply for open access, and once approved, I can buy power from any plant in India. It can be a solar plant, it can be a wind plant, it can be a hydro plant. So that's the basic foundation. This enables the customer, the consumer, to then now basically play around with a lot of things. Earlier, before the rules came into being, 2022, you were stuck to certain quantum and certain sources. Open access was there, but predominantly only 1 megawatt and above customers could buy. Now even 100 kilowatt and above customers can buy. That's the quantum of power you are consuming on a monthly basis. So now each state regulator has adopted these regulations, and they are getting more and more liberal in allowing customers to buy, to do a multi-sourcing strategy. This is where AI comes into the picture. So once you have a consumption profile, for example, you see the chart on top of the screen, that's a representative consumption profile. What does it mean? Any customer would either buy flat power, which means 24/7, or they would buy power according to their requirement from the grid. What the problem is, it is a very, very dynamic sort of affair. Human intelligence or Excel sheets or spreadsheets can go only as far as understanding how a customer is behaving. This is where we feed the entire data received from the customer, historic data, into a model, proprietary model that we have developed from ground. That model learns how you are consuming power, whether in the lunchtime your shifts are such that your consumption goes down, whether your plants are shut off in the night. All these things are emerge from learning this consumption pattern. Now once the consumption pattern is learned, we basically match it with the matching solar, wind, hydro, or whatever sort of green sources are available in the state or outside the state, and it then produces a sort of a chart or a curve or a sizing answer that this is the amount of solar or wind or hydro or green power that you should buy from the market, from vendors which will sell you power without investing a single rupee. They will sell you power like you book Uber. You need not buy a car. You just book Uber and go from point A to point B. Similarly, you book this power using the platform. So to summarize, the AI here is helping us learn the consumption pattern, fitting the consumption pattern with a suitable vendor which is supplying you that power by virtue of open access, and thereby reducing your carbon footprint and reducing cost. So that's how the sort of a jigsaw puzzle comes together. And with AI, this process becomes much simpler and much easier, because data crunching, large data crunching with a very advanced sort of algorithm becomes easier as compared to spreadsheets which were used earlier for the same process. So as I said, we have our own engine. We heard about OCR scanners. So OCR scanner is a part of the engine. It scans your bills. You have discom tariffs. You have multiple inputs coming into the engine, and then it basically processes the information and brings out that answer. Next. So I'll just show you the answer. This is how our answer looks like. This is a client, a cement plant, for which we did the exercise. What happened is that they had solar, wind, banking sources available. They had a mix of solar and wind profiles available within the state. The algorithm ran thousands of combinations of solar and wind, and finally told us that the client should install 18 megawatt solar, 30 megawatt wind, and the power purchase cost would come down from 7.49 per kilowatt hour to 5.49, leading to 13 crores of annual savings. Now, this size triangulation is impossible without having run a model which can run thousands of combination of various sources at different costs. It's like going from point A to point B, and you have 5 routes, 5 cars, different tariff, different travel speeds. How to optimize that? So that's the problem we solve with this kind of sort of model. Next. The second challenge comes that once you actually install solar and wind, then you have a scenario in which the entire weather impacts these sources. So now decarbonization as a step, the first step we took, we actually went and installed solar and wind and hydro and whatever sources are carbon free. The second challenge is most renewable sources except biomass are dependent on weather. So this is the second aspect of how AI helps. So AI basically helps you forecast the generation patterns of renewable sources by using weather, mostly weather as an input. And this is the second solution that we have developed. On a daily basis, we keep forecasting what you have deployed and implemented, and that problem runs in parallel to our sort of factory. Can you switch? Can we switch to the? Yeah, we'll just switch to the live dashboard. This is a live dashboard of a client. We have taken permission from the client to demonstrate this as a demo. This basically will show you, if you can get a glimpse of it, of how a real sort of challenge looks like on a daily basis. Just give it a minute. The idea is to basically not working. You can just do this thing. So I'll just sort of explain in the meantime. Just excuse me. Please. Yeah, sorry for the hitch. Just go to Firefox. Yeah. Perfect. Thank you. So this is a real sort of snapshot of a client. This is something which we have again built in-house. This is a real working demonstration of a factory in Noida of a snacks manufacturer. The gray line that you see on top is the demand, the real-time demand of the customer. Now, how the customer is using this to fulfill three things: ESG reporting, cost reduction, and decarbonization. So if you can untick the thing, the gray line demonstrates the demand. Now the algorithm learns how the demand has progressed over the past few months, maybe 1 year, and it starts buying from the solar. So this green chart that you see is solar. When solar is not available, then it buys from the grid. You can buy from the grid. Next one, grid. Yeah. Then it buys from the grid. If there are availability in the market that the power cost of exchange, there is an exchange in India, power exchange, is lower than the grid tariff, it will buy from the exchange in real time through the AI based insights. You can go to T+1 on yeah, just go for, no, above the other one, Upar, the other one. Yeah. No, after actual versus forecast on the left side. Uske upar wala. The other one, upper one. Yeah, sorry. So this is next, niche aa jao. So you can see the AI insights are here. So AI is constantly scanning. Go below, please. The AI is constantly scanning the market and go below. And basically, it will tell you this is pure LLM in real life. It is scanning your demand. It is scanning the power exchange. Whenever it senses that the power exchange is lower than your grid tariff, immediately it will give a recommendation that you buy power. If it is not, it will give a recommendation. For example, here it is saying do not buy. So this is now a human loop come to the play. You get an LLM response by a algorithm which is scanning the market, scanning your demand, giving you recommendations. If you like the recommendation, you can go ahead and follow it. If you don't like it, then you can stop. So this is how we have built human in loop in the entire agentic sort of cycle of going ahead and buying cheaper power as compared to what you can get from the grid. So this is one very strong sort of tool to decarbonize, to maintain ESG reporting. Go to today, please. So how does ESG reporting work? Now this snacks manufacturer can actually pinpoint. I cannot show you the production line. The production line is mapped to this energy consumption curve. Anything produced during these hours, during the day hours, is almost 90% green. So they can actually claim on their packaging that this packet was X% green. This is how ESG reporting is sort of solved. Some plants have actually been able to do 100% green by virtue of buying wind also in the night hours and solar in day hours. So this is how ESG reporting for any export to any CBAM compliance or whatever compliance is being exposed to can actually map the production line to the energy chart and claim that this product, when produced, we were consuming X% green energy. So this is one other added advantage in addition to cost reduction and decarbonization that one can avail. So this is how practically we have been trying to use AI for various energy specific compliances and decarbonization goals of various industries. And pharma is one industry which we believe can truly benefit from such kind of power related solutions. The second aspect, go to the presentation, please. Thank you. Yeah. So the second aspect is regarding heat. Yeah, same slide. Next. I'll briefly touch upon heat. Same concept. Any industry using heat. Next slide, please. Any industry using heat typically looks at boilers as a source of either hot water or steam. after the Ukraine, so there's a concept called heat pump. I'll talk about heat pumps in a bit. The reason why this has been lately a very strong sort of technology is after the Ukraine war, once Europe was sort of delinked to the Russian gas, they started heavily investing into heat pumps. The difference between heat pump and a boiler is a boiler generates electricity by burning a fuel. A heat pump displaces electricity, heat, which means any heat in any area can be displaced from point A to point B using a heat pump. Why this is important right now? Because with boilers, decarbonization is very difficult unless you're using biomass briquettes, which again ash handling and supply chain issues are there. With heat pump, you can go full green because heat pumps runs on electricity, and that electricity can be sourced from RE sources, like we saw in the previous slides. A heat pump is a device. In simple terms, it's a reverse of air conditioner. Air conditioner sort of pushes heat outside and cools this room. A heat pump pushes heat inside into a process and pushes the cool air outside. That's the in simple terms. We can do heat pump as high as 120 degrees centigrade, and heat as a service is also available, which means you can buy either steam or hot water. Capex is typically not required in such kind of solutions. Why AI becomes important in heat pumps? Again, similar to what we did in power, we can study the patterns of consumption of steam or water and size the heat pump very accurately as compared to a boiler, which is typically generally oversized. So this is a broad, a high level way of how AI and new solutions can help decarbonize the pharma industry. And this is what we wanted to sort of share with everyone. And thank you, Pharmexcil, for giving us this opportunity. I would be happy to take any questions on any of the aspects, please. Thank you. Hardware is developed is either on okay.
Let's say some units needs to, I mean, if they want to go for implementation. Sorry, if a particular pharma unit wants to go for implementation of your software, I mean, what is the hardware? I mean, I'm not sure if
only energy meters are required.
Okay.
Which are sort of given as a bundle as part of the software.
Okay.
Yeah. So you have to install energy meter at certain points to monitor the processes.
Because how do they know that? I mean, what percentage of the electricity is flowing from the grid and what percentage is coming from the renewable energy?
So we've installed meters at renewable energy plant also.
At the?
At the plant, renewable energy plant also.
Okay.
You saw the curve there. So we have installed one in Jhansi. The solar plant is in Jhansi. The factory is in Noida. We install everywhere. And we then overlap based on the timestamp.
Okay, so based on the power purchase agreements the units have,
yes,
you will install the meters at the source as well as
Perfect.
the consumption.
Yes,
and
yes.
that's how the people will be able. I mean, the units will be able to map.
Yes, and this meters will be sealed in the presence of the state government's employees, so that the carbon tracing is there. No one can say that meter is someone else's or mine. So the ambiguity is not there. That meter is mapped to that particular client.
Okay.
And that sealing is done by the state electricity board, so that we have one-to-one mapping of the generation and the consumption. That is how you get carbon benefits.
Okay, and the net metering, I mean, the wheeling charges and all those things that's taken care.
That comes in the bill.
Okay.
That comes in the bill every month, and through our software only, you can check whether the parameters are correct or not. All the formulas are built, coded in the algorithm.
Okay.
Yeah. So you get a landed cost.
So if there are no questions, then we'll move to the next session, which is before I close the session, I would request Akshay ji to kindly present here for. Thank you, sir. I now invite Akshay ji from Joint DGFT to kindly brief us on leveraging FTAs and the information on export promotion mission. Call them.
Good afternoon. From Directorate General of Foreign Trade, I'd like to make a brief presentation. The slides are quite a number of slides. I'd like to run through these slides. Basically, as part of this session, we'll be covering three aspects. One is the export promotion mission scheme, which was launched by DGFT recently. And second part would be as part of, covering the aspects of India's recent free trade agreements negotiated and concluded, basically the India-UK CETA and India-EU FTA, right? And the last part would cater to the digital initiatives of DGFT, which have been done the past couple of quarters, I would say. Yeah. Yeah. As part of the export promotion mission, the DGFT has come up with this particular scheme specifically for the MSME sector. The focus has been on the MSME units, MSME exporters, manufacturer exporters, and merchant exporters as well. And the objectives of this mission has been to give better access to trade finance instruments which are available and operated by the banks and non-banking financial companies, to provide assistance in getting certifications which are required for your exports in other countries, access to market intelligence and trade intelligence platforms, as well as to provide support to MSME exporters in e-commerce way. And this particular export promotion mission has sub-schemes called Niryat Protsahan and Niryat Disha. I'd like to explain them briefly. Niryat Protsahan as a sub-scheme, it handles to providing trade finance options for the exporters in general and MSME exporters in specific. Some of the sub schemes under these are interest subvention support for pre and post shipment export credit, support for alternate trade finance instruments like factoring solutions, which are operated by some of the banks and NBFCs. Also provides credit assistance for e-commerce exporters, collateral support for export credit, and support for emerging export opportunities. And the next sub-scheme under EPM is the Niryat Disha, which provides for the ecosystem of enabling market access for the exporters and MSME units specifically. Under this Niryat Disha, it helps in creating, supporting the trade regulations, accreditation and compliance enablement sub-scheme, where support financial assistance is provided for MSME units to get testing done, getting the inspection certificates which are required, whether it is for various aspects of the export products, right? Also, we have market access support, where exporters can participate in exhibitions, trade fairs, buyer seller meets, and reverse buyer seller meets. Some financial assistance capped at a particular value is being provided. Catering to the logistics aspects, the cost involved in this. Sorry. Getting to the logistics needs of the exporters, we have a scheme called FLOW, facilitating logistics, overseas warehousing and fulfillment. I'll come to that in a bit. We also have logistic intervention for freight and transport, which is for the domestic leg of the logistics part. And we also have integrated support for trade intelligence and facilitation, right? So with all these schemes, how does it help the MSME units? If you see from the journey point of, from the exporters journey point of view, starting from the market and product analysis to pre-shipment export financing, trade compliance, EXIM logistics, and post-shipment export financing, this export promotion mission under DGFT caters to various stages of the exports, and the benefits what the exporters can get is mentioned over here. That it is summarized, whether it's at the market and product analysis level under the market access support and insight sub scheme, and the interest subvention scheme for pre-shipment credit, collateral support for the export credit, and so on. And further, to reduce the cost burden on the trade certifications and the quality certifications to be done by various exporters, trade scheme addresses that particular issue. To address the cost concern for logistics abroad as well as in India, we have lift and flow sub schemes, and then for post shipment export financing, we have various schemes as mentioned over here. So how does this export promotion mission with all these schemes help MSMEs? So taking the whole of government approach, all the ministries, whether it is the commerce and other line ministries and other stakeholders and agencies, including export promotion councils, it helps to reduce the cost of an export product, not the direct cost in the manufacturing, but per se the other costs involved in marketing, logistics, certification, and so on. Right. So this also helps the MSME units to get access to lower cost trade finance options. It also helps in getting market access and support in increasing their market presence abroad. As I mentioned, the interest subvention support is already an existing component, the details of which is just mentioned over here. The arrears of the previously erstwhile interest equalization scheme of 850 crores has been cleared, and more than 3,000 exporters have registered for this interest subvention support as of now. Similarly, the collateral-free access to formal credit for MSME exporters under this particular subcomponent, where support is provided to different types of the MSME units. Micro and small enterprises are supported to the extent of 85% and to medium enterprises up to 65%. The maximum limit under this subcomponent, however, is rupees 10 crores per exporter. Many exporters have expressed interest. Market access support is to reimburse the cost which are involved for the exporters to participate in the buyer-seller meets, trade fairs, and so on. This is the current implementation status, where the previous areas have been dispersed under the market access initiative scheme operated by various EPCs, and a new allocation has been made for various trade fairs, which are around 34. One of the important feedback which we had got before rolling out the export promotion mission was in terms of non-accessibility and availability, and the affordability of also the various trade finance instruments at a lower cost compared to what is operated at the market level. So in that, to address that particular aspect, MSME exporters are now able to get low cost alternative trade finance instruments. It is specially designed for MSME exporters who are registered. They can avail such benefits from the registered export factoring companies or the NBFCs, and the interest subvention is borne by the government. Government also has put in a lot of thought in terms of encouraging e-commerce exports, because e-commerce exports have become bigger. I mean, it's year by year it's gaining traction in terms of the percentage of share in the total exports. To cater to their finance needs, MSME exporters are getting the benefits in terms of credit assistance. The nodal implementing agency is the Exim Bank, where direct e-commerce credit facility up to 90% of the guarantee of the cover is ensured, and interest subvention of 2.7% on eligible financing is eligible for the e-commerce exporters. With an objective of trying to encourage and trying to de-risk the exporters who are trying to export to the risky markets and riskier markets, having new markets with riskier or the new products, I would say. This support for emerging export opportunities is that subcomponent under which the maximum support in risk sharing manner is given up to 10 to it spans from 10 to 90% of the transaction value, and there are some caps, country-wise caps or the exporter-wise caps, which they are eligible. So this would we are of the opinion that it might increase the risk-taking ability of the exporters, considering that there is a backup from the government side. Moving on, we also have the component to reduce the cost on the certifications required. Specifically, the pharma sector also has a lot of certifications which needs to be done, and some part of the cost cost accrued will be reimbursed. This flow, now that we have done with the trade finance, the sum of the components under the Niryat Disha, we're just touching upon that. Some of the big exporters or some of the aggregators who are in need of the logistics or the warehousing needs in the other countries, we have made a component where they can get some financial assistance. The support would be to the tune of 10 crores or the lower of either 10 crore or 30% of the project cost in having overseas warehousing facility. I mean, if somebody needs to have a warehouse facility, to reduce the cost of the deployment of those goods based on the order, such facility can be operated upon, and DGFT under this particular flow subcomponent of EPM will be able to reimburse the lower of these cost of 10 crore or 30% of the project cost. Similarly, if there's a need for any exporter or an aggregator to have an overseas fulfillment arrangement, the per month 5 lakh rental, that reimbursement is available. In cases of somebody who needs to have a display or the exhibition center, the similar amounts, the 5 crore amount or the 30% of the project cost is eligible. All these applications, the applications for such kind of benefits can be made on DGFT or the Trade Connect portal. Now that we have talked about the logistics and warehousing options, the facilities which can be operated upon at low cost, considering this particular benefits, now we'll move on to the support what has been envisaged to the MSME exporters for the freight being moved from their location, especially the hinterland districts and so on, to the nearest the ICDs or CFS or the ports. benefit of up to 30% of the actual cost incurred will be reimbursed with a cap of 20 lakh per exporters per financial year. So the domestic leg, whether it's by road or the rail, based on the documents supported, the exporters will be able to get the reimburse under the lift subcomponent of EPM based on the documents submitted. Similarly, we have integrated support for the trade intelligence and system and facilitation being done. Now we have Nityat Protsan. I'd request additional DG sir to kindly throw some light on this particular aspect. Thanks.
Good afternoon, all. So, Government of India doing a lot for the benefit of the exporters. All of you know, they are leaving no stone unturned to improve the exports. Especially recently, Government of India come up with one proposal known as EPM, Export Promotion Mission. It is going to be the game changer for the MSME sector, and in order to make the Indian export system as a globally competitive, and to reduce the finance gaps and technical hassles and non-technical barriers, all those certifications, other issues. So EPM is going to be the main game changer for the MSME sector. Under EPM, an MSME exporter can get 50 lakhs per annum under the pre-shipment and post-shipment export benefit, and 25 lakhs for the certifications per annum. Especially pharma sector can also get the 25 lakhs per annum for US FDA certification each year. 25 lakhs are 60% of the cost of the US FDA approval. So that is the benefit under this one of the benefit, and they are going to give another benefits also, like already we discussed. Akshay, my colleague, already discussed some of these benefits, and already various trade notice have been issued for the operationalization of these components under the EPM. So you have to process these applications, you have to file the intent to claim and resubmission of the reimbursement of the claim, and the various processes have been there that you can get under the various trade notices have been issued. Under the trade notice, if you go through what is the procedure, everything is very clearly mentioned. And in the export promotion mission, who are the stakeholders? Everyone is stakeholder actually. Media, state and district governments, lending institutions. So it is a responsibility of everyone to make India as a globally competitive export house. That is the purpose of the EPM. So this is one of the recent scheme introduced by the Government of India because of this Iran-USA war. So relief scheme. Under the relief scheme, exporters are going to, the Government of India is ready to bear your increased cost on the insurance, additional cost on the insurance. So ECGC is going to be the implementing as a agency for this scheme. 3 categories are there under the relief component 1, under which your consignment already gone 14th February to 15th March 2026. So where the consignment already gone. So that is component 1. Component 2 is the exports to be made from the 16th March to the 15th June of 2026. And component 3 for the MSME sectors which are outside this ECGC. This is relief scheme is going to be one of the benefit for the exporters which are being affected by the India-Iran, USA and Iran war, West Asian crisis. And next, various FTAs are being signed by the government, especially in the recent years. Government of India is signing the various various FTAs for the benefit of the exporters. Global pharma market is greater than 1.5 trillion, whereas our exports are only 30 billion. So we are having a lot of potential to capture. The sky is the limit for our market. As our commerce secretaries are highlighted, now we have to high time to move from the volume to value based products. Then only we can sustain in the market. So it is high time to move towards the, because you are not only exporting the goods, you are exporting the Indian image, Indian brand to the rest of the world. So whereas other products like agriculture products, engineering goods, that may not affect the human beings directly. Whereas these pharma products, if you export spurious products, immediately you will, many deaths may happen. Recently it happened. So it tarnishes the image of India. So it is high time to move from the high volume to the high value production. So whatever the harmonization of the standards, that is very, very essential. That's why in the EPM mission, Government of India is giving 20 lakhs per annum for USFDA approval. So this is about the how to utilize these FTAs. You look at the recent FTAs. In the last 5 years, we signed around with 38 countries. India Mauritius Agreement and India UAE Comprehensive Economic Partnership Agreement, India Australia Economic Trade Agreement, EFTA, PEPA, that is with the European Free Trade Association. And next, India UK CETA. Regarding India UK CETA, the request is mostly the India UK CETA going to be operational next month. So I request all the exporters to postpone your consignment on the day of the operation of the scheme, because it will be the win-win situation for you and the importer. Because once India UK CETA is operational, the tariff will be zero. So it will be win-win situation for you and the importer. He can deliver to the domestic market at a cheaper price when compared to today. So I request all the pharma exporters to postpone their exports for the launch of this India UK CETA, maybe in the 3rd week of April or last week of April. So before the this India UAE FTA, the tariff is there, but now it has become zero in some of the antibiotics like Rifam, penicillins. India, Australia also, it has become zero actually. Next, advantages of FTAs. All of you know FTAs are a launching pads for to capture the markets. So FTAs you have to use properly, otherwise they are going to be backfire. So you have to penetrate the markets wherever the zero duty is available for you, along with the necessary compliance regulatory standards. That is very essential actually. So India have to advantage with the UK. So this, you look at the data actually. Indian exports around $30 billion, whereas we are exporting to UK only $1 billion, whereas UK importing $30 billion from the rest of the world. So what is the opportunity? Lot of scope is there for India to capture UK market, provided you move from the volume to value based supply chains. That is essential. Then only we can capture, because we are having lot of technologies there, Indian manpower. You see, all global standards are available, but only thing is we have to think, our attitude you have to change. Then only we can capture. That is very important. So I request again all the pharma exporters to postpone your consignment on the day of the launching of the India UK CETA. It will be win-win situation for both the exporters and importers. Next, these are the some of the, we are going to share this PPT with you. You circulate among all the exporters. So these are the some of the areas where what is our share to the UK and what is the total imports of UK from other countries. This clearly indicates there is lot of scope for the India to capture UK market. And India, this is also very important. You look at this pharma market in the EU. European Union also, there is a lot of scope is there for various products. So it is essential to capture all this, the gap between the already existing and to be captured. That is very, very essential. So when you are entering the market, some of the each market is unique. You can't compare the UAE market with the Australian market. You can't compare the Australian market with the African country market. So some countries expect the higher standards. So you have to, and if you are capturing the Japan market, there you have to take care of the more of the geriatric medicines, maybe with the more requirement because of the senile age of the population. So Japan market may expect you to export the more of generic geriatric medicines with high regulatory standards. Whereas Australian market also expect the more of the regulatory standards are very high. So you have to change the strategy according to you the market which you are exporting. That is essential. Otherwise you can't diversify and capture the new markets, emerging markets. Then the most important, our CSR also, Commerce Secretary sir also told, Trade Connect e-platform. So earlier exporters, they don't know where to export, how to export. Very haphazard situation. They are in a dark room. They don't know how to export and all. But after this Trade Connect e-platform, the game has been changed. A small exporter sitting in a nook and corner of the India, northeastern region, or Hyderabad, Srikakulam, he can also export. So that is the Trade Connect e-platform has been the game changer for the small scale exporters, especially MSME exporters. Whereas already big players, they are having the mark, they know the buyers. But whereas for others who are the startups, it is going to, I request all the exporters use this Trade Connect, trade.gov.in. So there is a need is actually because of the gap between the what is available and no centralized information. So we don't have any available data, especially global e-commerce platforms. We don't have the what is the FTAs are signed by the government of India. If you go to the trade.gov.in, you can go, you can search what is the duty on your export item under this FTA. So all those details are available so that you can search whether it is competitive for you or not. So various trade agreements and trade explorer, tariff explorer is there. How to export. In that you will get all the which country is competitive for you. All those details are available. Only thing is you have to explore. Like our kids play the video games. They take the mobile and play the video games. You also start exploring the Trade Connect platform. Then only you will come to know what are the various issues. Next, global e-commerce guide is there. In that e-commerce guide, you will have all the list of the e-commerce platforms. So you can have the access also of the e-commerce platforms. Next, trade events happening worldwide. Our Pharmexcil trade event is also happening. That will be available in our site, Trade Connect platform. So it happen everywhere, all over the world. It can happen, any event happening, so that you will get an opportunity to showcase your products. So that is one of the main advantage of this trade events worldwide. Next, Exim Pathashala. Exim Pathashala means you will learn the basics of the export import, how to export, what are the basic documents required for exportation. All those are available under the Exim Pathashala. Product guide. Product guide clearly indicates which product, what is the requirement in various countries, what are the various certifications required for export of that product. Many of the exporters, they send the goods, but they don't know what are the documents along with the necessary certificates. That is very, very important. Especially compliance to the necessary standards are very crucial in the highly competitive market of the present days. So product guide will give you all the details. So for which country, which are the tests mandatory. And country guide. So if you go to the country guide, what are the various goods imported by, so that you may come to know the what are the requirements in that country, so that you can plan according to the because always economics only plays on the two issues, demand and supply. So if you know if you match the demand and supply, wherever demand is there, then you have to supply. The supply is more, you have to change the market. So economics always plays on the only demand and supply. The concept of economics starts always with the scarcity. Where the scarcity is there, then your entry is required. Scarcity is the basic concept in economics. So you have to find out the scarcity. So you have to explore the scarcity markets. Then only you can become the successful entrepreneur. Then source from India. Under the source from India, you can showcase you can register with your IEC and you can showcase your products so that the international buyer, he may contact you directly. So you are giving the details of your products, what are your qualities and where you exported already. So source from India, in that you are going to display your company name, what are the products and all those. Create your profile actually. So like that matrimonial profile is there, no? Matrimonial profile, what happened? So if your profile is good, first WhatsApp profile pic is there. Profile pic is something and actually sometimes it may be there, but try to maintain the same actually. Whatever you update the profile and try to maintain the same profile also. Don't change, because the customer, it's a long-term relation, trust-based relation. Why so many these breakups are happening nowadays? Because of this profile is something and after something that is happening. The gap is there. So you create a profile where the real profile, that is important. So ask an expert. Ask an expert, actually this is also very, very important. Secretary sir is saying actually. So you will get you can raise your question and they will forward to the concerned department and they are going to give the reply. So that is very, very important actually. You see, whatever the question we can raise and you will get the reply from the concerned department. So you can get under FTAs, what is mandatory? Certificate of origin is the mandatory document under the FTAs. So certificate of origin also you can get from the Trade Connect platform. So last but not the least, under the government of India, exporters are getting various schemes. Like earlier you may be getting many schemes like FMS, FPS, MES, SCS. But still, two most important schemes are there. One is advance authorization, another one is EPCG. So advance authorization is required to import the required inputs for you to manufacture the exports. That is advance authorization scheme. Another scheme is EPCG scheme. What is EPCG scheme? You can import the required capital goods, machinery, whatever is required to manufacture to turn the inputs into the finished products. For example, you are starting pharma company. What you require? You require the raw materials to manufacture the formulations, like APIs you may need, and you are going to turn the APIs into formulations. And what are the other things you require? Capital goods. Under EPCG scheme, you can import the best technology capital goods available anywhere in the world. So in order to make you competitive with the rest of because when you are exporting, you are competing with the rest of the world. You should remember. So government of India intention is to make you competitive with the rest of the world. So for that purpose, EPCG scheme is available. Under EPCG scheme, you can import the required capital goods without paying the basic custom duty and IGST, but you have to export the 6 times of the duty saved value. That is very easy for the startup. To close the EPCG scheme, very easy for the startup because you don't have the average export obligation. Whereas for established player, he has to maintain his average export obligation and he has to maintain a specific export obligation also. Advance authorization, you have to import the required inputs, you have to create 15% of the valuation and export it actually. So government of India doing their best to promote you as an exporter, especially recent 10 years back to take IEC is very, very difficult. But now within 1 hour you will get the IEC. So everything is in front of you. It is your choice. You see how the career of the Adani, Ambani, their career they started with like you only actually. JSW, their growth is like that only. If you 30 years back, their growth is like that, like you only. But because of their willpower and ultimately God's grace is very important. So they are able to grow to that level. So utilize all the benefits provided by the government of India and emerge as a leading entrepreneur and exporter. Thank you all.
Thank you, Dr. Sampath Garu. I think the way you explained it is like it reached everybody's heart and soul. So I think everybody will take advantage of what Sir has explained, and also on the EPM scheme, Chavanji Akshay ji has explained. Now I take this opportunity to request DG Pharmexcil to do the honors for the officers who have spent their time today. Sir, please. Dr. Sampath Garu, please. I would also request the officers from the EGFT to join. Huh? 7. Yeah, sure. Dr. Sampath Garu, one group photograph with your officers. Yeah.
Thank you so much.
So, Sampath Garu, the way you have explained, I think now we have to organize a separate program for the pharma exporters. We will seek a date from you, sir, going forward. Thank you again, everyone who have joined here today's program. With that, the sessions are over. Now, I will not come in between you and the lunch, whoever has not done it. So, kindly join us for lunch. Thank you so much for joining us. We will be sharing the presentation copies with all the participants. Thank you so much. కనబడలేదు సార్ అవును దేంటి ఇక్కడ ఉంది Yeah. We also have Dr. Satyaprakash Garu, JS DOP Department Pharmaceuticals. I would request him to kindly say a few words, more of a concluding remarks kind of thing, on the Chintan Shivir today.
You have 3 minutes, not more than 3 to 5 minutes. I will not take much. Everybody understands that pharma is one area where we have natural competitiveness. Come what we will perform. There are reasons for it. Long back we started on reverse engineering and we have mastered the art of it. But now, today, everybody, whatever comes, people say that, oh, China is doing this, China is doing that. Then why don't you do it? If a child gets up at 5 o'clock and he starts studying, and your child starts at 9 o'clock, and then say that, look, that neighbor's boy has got up at 5 o'clock, how can you complain? You also get up at 5 o'clock. So there is clearly one single direction we have to move on. Either you are on table or on menu. If you don't want to be on table, you are on menu. So somebody will eat you out. So now it's the right time to come and work together and act together. And how the policy moves. If I make a policy, the same 10 people will be telling that what nonsense is the policy. Okay, this time my secretary says, you don't do the policy, let industry do it. Now no industry is coming forward. Come, if that is the case that we don't formulate proper policies, you come down, nobody is coming. Interestingly, pharma is a sector where we create policy in the intersection of finance, R&D, and administration. So we are administration, R&D and finance you take together. You know how what is the cost at which you can produce something. I will give you one very simple example. In the morning I told you about the semaglutide. There is this, in defense colony, there is this restaurant by name Sagar Ratna. What he does, every day, 8 o'clock, he comes out with a coconut, he does puja, and then he breaks it to the ground. And there are 50, 60 pieces, and everybody will be there, and they will keep going and capturing all those. And I had 4 pieces, I had 5 pieces. The same thing is happening with semaglutide. Semaglutide went off the patent, and 58 people are producing today. We are not producing semaglutide. Semaglutide comes from China. $200 you buy, they produce at $20. And out of 1 gram of semaglutide, you make around 2,200 doses. That means to say raw material of 1 dose of semaglutide with maybe 0.35 mg, 0.5 mg per dose. So that is 20 to 25 rupees. All put together, you will be doing it at 60 rupees. Marketing, everything put together. But you will be selling at 300 rupees. Okay. So 20 rupees worth material, you are selling at 300 rupees. That means say 100 times. Why don't you produce? No, China is doing that. China is doing that. Why will you not do it? Now, it is, the challenge is to be taken by the industry and tell what should we do. What government should do. Probably here is a government which says that, yes, we understand the challenges, but let us go together, let us put our acts together, then provide policy. Where is that? Okay. Unless the inputs come from industry, get consolidated, and give a clear direction to government. Probably this is one government which says that, okay, whatever industry sees, we will do. This is a golden opportunity for you. So let us put our acts together. Let us not blame about China. Let us make our kids get up at 5 o'clock. Let us give everything to them so that they will perform better than China. Thank you.
I said, no, it's not enough.